Ok, entonces ya le espero, profesor.
Tú eres la única en el.
Yo está bien.
Sí.
Ya voy, panza. Gracias.
De, Tienes que encontrarlo acá. Más bien, este link hay que guardarlo en algún lugar para no estar buscándolo.
Guardarlo.
Sí, en el draft lo voy a guardar, ¿eh?
Ahí todo lo guardo yo en mi draft. Después voy a borrar todo.
Tienes que borrar eso.
Ya, después tú pones ahí en la basurita y pones toda la chingada.
Ya cuando te den tu nota para todo, ya.
Borra. Qué bueno, el draft sirve. Es como un pequeño, un pequeño garbage, pero sirve mucho. Todo después lo hacen el trabajo. Ok. ¿Te acuerdas que una viejita pegalona?
Sí, una japonesa.
Nada más que te mandé una foto. Yo me quiso. Ya no me chacaba. No sabía pegar sin poder. Me van a meter un gomazo que me aguantaba. Pues sí son muchachitos. De las demás que venía les pegaba y a mí no. A mí me daba que me sentía a su lado. Viejita, después que me gomeaba. Ay, así hay pacientes que te pegan.
De ahí nomás. Sí, ve.
Marista, es un conchito. No sabes si tanto conchito. ¿De quién es?
No sé, de Gonzalo, ese fue
Pues ahora es mío.
tu poncho.
Digo que tiene que ir.
Es un poncho, ¿no?
Y qué bueno que existe. Porque ahora me lo vas a zafar.
Sí, está.
Y no pica. Pero bien cerradito, cerradito, que no es para salir esta huevada.
No menos con trompo.
No, quizá para andar. Así. Bueno, yo que soy mayor sí puedo andar con mi poncho. Otro no, pues no, así con poncho.
No, ya no se puede con trompo.
Mm.
¿Qué acabas de dar?
Yo no, todavía.
Ah, no hay. ¿Eso qué cosa es?
Una pastilla para la acidez.
No sé qué se llama.
Un poncho de ahí que encontré en la cuna para el frío.
Ah, ese poncho, me lo dio tu hijo a mí, pero ya está bien, úsalo.
Oh, gracias.
¿Mm?
Está bien, porque tenía frío.
Hace frío, ¿no? Yo pensé
No,
que yo,
es que ahí cuando ya estoy mucho rato, ya tengo frío.
yo pensé que yo no tenía frío. Fallo,
Estoy descansando adentro.
fallo, fallo. La media, fallo, fallo, fallo. Y Juan está parecido los colosos.
Ya no tengo fuera, pero
Yo ni me venía caminando para el
afuera del Pan Express, ¿te acuerdas que estaban sentados reuniendo todo el día?
no solamente en el
Allá,
pan,
allá en Montevideo.
¿cómo se llama esta tienda acá? La Matilda, y un poquito viniendo de allá, viniendo, como que se dice, ¿por qué no fuimos a comprar comida?
Nos veíamos.
Ya no hay nadie aún. Está bien. No hay ni un vato ahí allá. Se han desaparecido los güeyes. Pues es todo perfecto en todo, en la pandemia, en todo, todo perfecto.
Pero un error diario. ¿Cómo lo ven acá?
Es mi hermano Alcide me dice que el presidente Trump está haciendo lo que todo presidente debería hacer. Todo el mundo le dice bruto, pero no es bruto. Es el más inteligente que todos, mire. Así se usa. Así debe ser, un gobierno tiene que ser nacionalista, mire. Sin ser de derecha, de izquierda, cualquiera que sea, pero tiene que ser nacionalista. Primero su gente, pero acá, acá, mira, ve. Él está regalando plata a la gente que vende. Y él dice, bueno, ya. Esa es otra cosa, eso no es cosa de ahora, mamá, eso de ya de hace tiempo.
Pero tampoco tuvieron para los huracanes, no tuvieron para ayudar a la gente.
Ahí la cagaba el tío, bueno.
O sea, no están preparados para las emergencias. Están cagados. No, pero vaya para
Lo general, no puedo hacer. Yo la he cagado, hijo, pero lo perdono al tío porque no ha sido su intención. Como buen cristiano. No, pero él ha tenido, no se quiso rectificar. Exactamente, se pencó y acabó. Después no fue porque en el Perú te cerraron de mierda, debió ser lo mismo. No tiene huevo. El propio país que está matando a la gente. Dice tu tío, es que en el Perú está peor, pues, ahí se han metido y están matando a la gente. No jodas, pero dejan trabajar, puta, que no han cagado, ¿eh? Así dice tu tío, aunque ese uno opina por la culata también a veces, o por la contra opina. Pero aquí sí creo que tiene razón. Cuando empiezan a hacer, pinches, Pablo se cae en la mesa, puta madre. ¿En qué más de morir? Para chupando esta. Cuando se encarga, risa. Ahora, mejor que tu tío dijo que se ha muerto de cáncer en vivo y tú te quedaste. ¿Ah? ¿De qué quiere que se muera? Para chupando todo el día.
This week, we're going to look at two body systems and medications for respiratory and the gastrointestinal system. So you have chapters for respiratory, chapters 54 through 55, and then your chapters for the GI system are 57 through 56. You also have two ATI or easy modules this week for each of those systems, which will help in your studies. So here it is. Once again, it's kind of broken out into the respiratory system and GI system. So we'll look at these in two parts. So as we begin, we will look at medications for the upper respiratory system. This is chapter 54. We use medications for the upper airway for uses like allergies, rhinitis, the common cold, influenza, and maybe coughs. And you do need to understand that these are not cures. These will only help manage and lessen symptoms. So our 5 areas here, we have antitussive. Antitussive suppress the cough reflex. Our prototype medication here is dextromethorphan. Okay, benzonatate is another medication that is an anesthetic. And then we have 2 controlled substances, 2 opioids, codeine and hydrocodone, that we can use here. We have then our decongestants. These help decrease that overproduction of secretions, in which we have 3 different administrations that we can use. We can use these topically, nasally, so nasal sprays, orally, and then nasal steroid as well. So watch the use for these because we can have frequent, we can have rebound congestion with frequent prolonged use of these medications. You want to make sure your patients are using these appropriately. Then we have antihistamines. These are primarily used to reduce allergy symptoms, like maybe your itching, runny eyes, itchy nose, congestion a little bit, okay? With our antihistamines, we have first generation. This is your diphenhydramine. You might have heard of this before. This is your Benadryl. And then your second generation, like cetirizine, loratadine. Those are really common and they can be over the counter. The difference between first generation and second generation is the sedation quality. So with our first generation medications like diphenhydramine, we can expect some element of sedation. Promethazine is also a medication in this class. You might know this as Phenergan, the brand, widely used also for nausea and vomiting, okay? Our second generation antihistamines are non-sedating. So that's a big difference you want to be aware of, especially with safety. Okay, and then we move on to our expectorants. This is guaifenesin. These increase productive cough that help clear up the airways, okay? And then we have mucolytics. These also increase secretion in particularly high-risk clients. Your prototype here is acetylcysteine. Acetylcysteine, if you recall, is also the antidote for acetaminophen. So there's 2 different uses there for acetylcysteine. Okay, there's some of your key points. Clearly, you need to do very careful respiratory assessment anytime we're giving respiratory medications. Many of our respiratory meds also can cause some pathomimetic symptoms, which means we increase all vital signs, but we're able to open up the airway and increase our respiratory rate. You can also cause that drying where we slow that GIGU and some anxiety. Consider your non-pharmacologic comfort measures for anything respiratory related and really careful over-the-counter safety, including particular elements for children's, pediatrics, infants, and watch for duplicates. Acetaminophen is in a lot of our over-the-counter cold and cough medicines, okay? So watch for that. So then moving on to our lower respiratory medications, these are in chapter 55. We use these for more of maybe our serious respiratory disorders that can be acute or chronic. Okay, so things like bronchitis, pneumonia, asthma, COPD, maybe respiratory distress. So our first area here are your xanthines. You might also see these labeled as methylxanthines. Okay, these are for symptomatic relief of asthma and COPD. They bronchodilate. These would not be used for acute asthma attacks. Okay, it's going to be important that you know what medication is used for acute attacks versus for chronic long-term maintenance. Okay, so your xanthine here is theophylline. This is a toxic medication, so we do need to monitor our serum therapeutic levels very carefully. Adverse effects are directly related to the blood levels. which can ultimately, you can see there, become very serious. There are some important interactions with theophylline. We want to avoid caffeine, okay? And then smoking is always a good thing to avoid, but it can increase metabolism of this drug. Oops, wrong way. Then we can go on to sympathomimetics. These mimic the sympathetic nervous system where they open the airway and they increase respiratory rate, they increase that respiratory function. These, your prototype medication here is albuterol. You might have heard that before. Some of these sympathomimetics are direct beta 2 agonists. You will see that a lot. B2 agonists like albuterol. These can be used for our acute asthma attacks. So if I'm having some airway issues where I'm breathing really fast and I have asthma, albuterol is what you would want to get me to open my airway quickly. You will see, epinephrine as well, and formoterol in different, combination drugs. Okay, isoproterenol, salmeterol are also used. Watch for those sympathomimetic stimulations, so vital signs increase, GI, GU decrease. And then we have anticholinergics, which also increase the sympathetic nervous system, if you recall from our ANS medication discussion. These will treat bronchospasm, particularly associated with COPD. They are pretty good at opening the airway, but not as good as your sympathomimetics to the left. Ipratropium is your prototype here, often used within a nebulizer treatment in the hospitals. Okay. Then we have inhaled steroids. These prevent and treat inflammation swelling of the airway. These are not going to be used for acute attack. Okay. If we need both maybe a sympathomimetic and inhaled steroid, we will use the sympathomimetic first to open the airway and then follow that up with an inhaled steroid to reduce that inflammation. Budesonide is our prototype here. You can see maybe our Sones and some loans there. Remember all your problems with steroids, including increased infection risk. So we are at risk for fungal infections within the mouth, like thrush. Make sure anytime we're using an inhaler or nebulizer, okay, we need to rinse out our mouth after. Then lastly here we have leukotriene receptor antagonists, like zafirlukast, but montelukast probably are more widely used drug currently. These are not for acute attacks, okay? We do have some adverse effects associated particularly with montelukast, like depression and suicidal ideation. So watch your clients carefully for those, okay? Montelukast we also normally take in the evening. Okay, there are other respiratory agents I have listed. You can look at those like lung surfactant particularly, which is given to our neonates that haven't yet, that are born too early to produce their own surfactant. Okay, and then I have those 3 devices there. You've got your MDI, which stands for metered dose inhaler, which we can add a sensor in. We have a dry powdered inhaler and then a nebulizer. Please understand administration instructions for these 3 devices. That's going to be really important. Okay, so you can see other key points there. Just careful respiratory assessment.
Va a quitar su bandera de todos lados, por favor. Ponen eso porque tienen el territorio marcado. Eso que quieren decir.
Let's move on to part 2. These are our medications for GI secretions, chapter 57. Kind of flipping gears here, and we use these medications to treat GERD, maybe peptic ulcers, and perhaps replace digestive enzymes. Okay. Our first group here are histamine 2 antagonists or H2 antagonists, like cimetidine. These will block hydrochloric acid to help with heartburn, GERD, treat ulcers, and also bacteria known as H. pylori. It won't cure that H. pylori. It will help the symptoms of acid reflux and ulcers associated with H. pylori. All of these end in dine, so we can dine with H2 antagonist. Then we have antacids. Your prototype here is sodium bicarbonate, but our calcium salts like Tums, the brand name here, help neutralize stomach acid. Okay. Then we move on to proton pump inhibitors, our PPIs. These suppress hydrochloric acid for short-term relief of GERD, ulcers, and most of your hospitalized clients, unless they have a clear contraindication, will be on a PPI to prevent these sort of stress-induced acid reflux and ulcers. Omeprazole is our prototype. All of these PPIs end in prazole, PPI prazole. Okay. Then we have a medication, a GI protectant medication called sucralfate. This helps coat the stomach lining to prevent that further breakdown from acid if we are really dealing with stomach ulcers, things like that. Administration is very important for sucralfate, so please know that. And then lastly, we have prostaglandin, a prostaglandin. These prevent NSAID-induced gastric ulcers. If someone takes NSAIDs regularly, this is misoprostol. Looks like I have the wrong image there. I'm sorry. Misoprostol, I just noticed that. This is contraindicated for anybody that is pregnant because it can induce labor. So if we use misoprostol to prevent NSAID-induced gastric ulcers, we usually need a negative pregnancy test. There are drugs for digestive enzymes, and here are some of your key points for these GI secretion meds. Think about lifestyle changes, non-pharmacologic comfort measures, think about over-the-counter safety. Okay, in chapter 58, we have drugs that will help with GI motility. So here's where we talk about laxatives. This is preferably for short-term constipation relief, prevents draining, also to help evacuate bowels before a procedure like a colonoscopy. Okay. We have quite a few groups here, so you want to familiarize yourself with each of these and how they work. The last group, they're specific as an opioid antagonist. Methylnaltrexone. This will help with that opioid-induced constipation if people were using.
No, yo voy a hacer nueva sopa, tómanse todo eso. ¿No? ¿Me puedes regalar un poquito de leche cruda acá para echar? Acaben eso y necesito la olla.
Stimulants, these increase the parasympathetic nervous system that rest and digest. This is metoclopramide, otherwise Reglan. Increased GI activity.
A ver, si me ponen la olla, yo hago mi. Necesito la olla grande. Espérate, poquito nomás. Acerca el huequito. Acerca. No voy a levantar. No, es que así a esta altura vas a botar.
Revisa.
Ya, ahí está. Gracias.
Okay. There's your key point. Think about over the counter safety. Think about route of administration. Think about potential. Think about lifestyle. Increase that fiber, increase the fluid, or remove.
Madre.
¿Cómo se llama eso? Tortillas ahí.
Mobility exercise.
Yo he comprado.
Sí, come todo eso.
Hay días que no se limpia esta cocina. Yo no me estoy limpiando. Está abriendo el pan.
It's okay.
Ese parece.
Sí, dependen.
El giro se quedó huevón, macho. Ya, sí se quedó. Ay, pues ya no hice diseño, mierda. No sé. Yo, sí, bueno, yo hice lo que manda la Biblia.
Es que no estaba bien, pues. ¿Cómo van a meter 11 millones de esos sudamericanos malcriados? Todo acá no se puede.
Pero la peor gente. La peor gente ni siquiera han venido a la.
Hasta el tren de Aragua se habían metido, oye.
Está acá. Están tranquilos, nomás están calladitos, pero ahorita van a salir solos. Es que acá por todos lados hay cámaras y están cagados. Y los que han hecho la cagada ayer ya cayeron, rapidito, ¿no? Hicieron la cagada en Carolina del Norte y los han capturado en Texas, en otro estado. Digo que son delincuentes itinerantes. ¿Sí?
Una locura que entre el tren del agua de Estados Unidos, o sea, que la cagó el tío feo. Por eso perdió fe.
Ya le declaró la guerra, ha dicho todo Cristo.
Perfecto.
Yo pues estoy de acuerdo con todo lo que ha hecho este huevón también. Lo único que no se le vaya a pasar la mano, no.
Que no toquen a los países.
No, ya tocaron a los países.
Ya, entonces sí va a haber punto campo, porque cabrón.
Han ido a un lugar y no sé de dónde, de Florida, no sé de dónde, y han deportado, hoy día han deportado 813, perdón, 863.
Okay. And our last
Ya nada más,
checklist
pues.
are your anti-emetic drugs.
5.000 al día van a llegar.
Rapidito nomás.
Nausea and vomiting is a very frequent complaint in the hospital. So our first class of
Ya están
drugs,
llegando a México ya.
amazing,
Están en Tijuana los paisas.
prototype.
Han cometido una injusticia con nosotros, están declarando. Han cometido una injusticia con nosotros.
So
Nosotros estamos trabajando en el campo unido y nos han sacado de ahí. O sea, han estado en su chamba, en el campo, esto ahorita.
¿En qué estado ha sido?
Creo que ha sido en Colorado. En Colorado, ahí, los han sacado de la chamba. De la chacra los han sacado.
Here for this group. On
Estoy diciendo que se habla
do have
Sí, le dice,
justo por ganar pesadores.
syndrome.
sí, pero ¿quién se acuerda de eso?
No hay importa. Un ratito, dicen, pobrecito, después le dieron mucho.
Tuvo mi socio.
Gracias.
Me reportaron, pobrecito.
Continúa, no es un problema.
That will help treat nausea and vomiting, and then miscellaneous agents
¿Dónde
here.
compran las células?
Dronabinol,
¿Dónde compran las células?
meclizine, scopolamine,
21 dice acá.
and scopolamine particularly
hemos
will be a
comprado.
patch that you can get
Un huevo,
Panes.
to help
Pan.
you if you're going on a cruise and you're worried about these
No, ya.
Okay, there's some key points for you. Watch your GI assessment, consider timing, and route. If
La
somebody
gente
is
está
going
condenada que las manden
the oral route might not be the best option for you, so make sure you're.
Son tan lechidos que van a mandar a la gente que no merece y ellos se van a quedar. Ojalá que no.
This unit, available resources, campus construction, questions that you. And I'll see you next week. Thanks, you guys. Bye.
Los que deberían estar en Pindingo son esos que han entrado y les han dado papel acá, sin calificar. Eso deberían estar en Pindingo, pero yo no sé si eso están en Pindingo. Ustedes han comprado dos nomás. Dos estos de Panda. Ya, no faz allá.
Me salió un gato en una luna esperando.
¿Gato qué?
Un gato ahí.
Bueno.
Ahí estoy yo esperando. Ya hay dos gatos ya. Somos dos en el chat.
Ahora con esos delincuentes, igualito que en Sudamérica están haciendo, hacen la cagada en un país y se van a otro. Hacen la cagada en Perú y se van a Chile. De Chile se van a Brasil. Y así andan haciendo muertes por todos lados.
Ah, por todos lados.
Así están haciendo acá. Se fueron a Colorado, robaron una joyería, mataron no sé quién, se han ido a Texas, fueron por Dallas primero, después Texas, no sé. Y ahí los han capturado casi en la frontera, ¿eh? Casi para salirse los han capturado. Así la cagada en otro lado.
Se ha notado la tranquilidad y la vaciedad de las tiendas y afuera de las tiendas.
Acabó el laberinto.
Sí. Eso bueno, ahí hablando fuerte, con su música, sentado todo el día ahí, haciendo nada.
Igual que en Sudamérica, hombre. También así para en Sudamérica. En Sudamérica no hay ni mierda, ¿no?
No hay futuro, nada para qué intentar.
No, pues si vas al trabajo y en el trabajo ya tienen a quien contratar, ya puedes algo ahí. Por más preparado que seas, más preparado tú, pero igual te mandan a la mierda. No hay vacante, no hay vacante. Ah, esto no funciona más. Pierdes el tiempo ahí, gastas papeles, pasaje, tiempo. Nunca consigues trabajo. No, me va a decir.
Poniendo orden, ¿no?
Ahorita, los primeros días, sí. Ya cuando está a la mitad del mandato, ya la gente se va, puta, que este huevón se pasó de concha, se pasó, empiezan a criticar, órale,
De
lo
la
mismo
ahorita.
que lo adulan ahorita. La gente es así. Por una parte dice que va a castigar a los criminales y por otra parte está soltando a los que atacaron el Capitolio. Esos son criminales, esos entonces, son criminales.
Delincuentes.
¿Y por qué no sueltan? Es una contradictoria de él. ¿Mm? O sea, a sus delincuentes de él no, al resto sí. Yo pendejo, así no es la cosa. Igual Biden ha inventado también en su familia.
No es pendejo, pues cualquiera son. Ya, lo que traigo ya no lo llevo.
No, pero es
Parece como un ridículo.
chachiroso.
Sí. Hay una ley de lo opuesto, de las posiciones. Oposición. Mientras tú más das, la gente más que devuelve.
Gente.
La vida, la gente no sé, más das tú y la gente más. No,
No siempre, compadre.
no siempre,
No esperes nada.
hablando generalmente.
No esperes nada.
La otra cosa es
Mientras más bueno eres, más te pagan, peor te pagan. No está viendo lo de Biden. Un hombre de bien, compadre. Ahora dice que es una mierda, que la ha cagado. Ahora el hombre es lo peor que haga. El hombre ha querido hacer y no lo ha dejado también.
Todo lo han bloqueado.
Ah, todo lo han bloqueado y
Cuando tienes paciencia, los resultados vienen más rápido. Entre comillas, más rápido. Cuando más das, más recibes.
pues sí,
Cuando estás tranquilo, solo, estando contigo mismo, es cuando más la gente te busca. Quieren estar en tu compañía.
son los únicos que están con Biden.
Cuando no necesitas nada es cuando te llevan más transporte.
Los que están con Biden, los únicos son su familia, su mujer, sus hijos. Pues el resto está en plan de tesoro. Lo mismo que se beneficia, pues. La vida está llena de ingratitudes, hijo.
Sí, la
No te
gente,
sorprenda. No te sorprenda nada.
no, todo es posible, déjame decir. Su madre, tú eres una persona bien negativa, ¿no? Así, más de tú, pues,
¿Entiendes?
tu forma de ver, las cosas. Es cierto, pero también,
Pero mira lo que le está pasando a Biden.
ya sé, es cierto.
Un hombre de buena voluntad, ¿no?
No, a gobernarte no pasa nada. Ya que no.
Un hombre de buena voluntad, compadre.
Merece 2 periodos.
Para que se han beneficiado de los que pican,
Sí.
que no lo crean. Y si la gente
No, ¿me como esta quesadilla?
Claro.
Ya. Me estoy comiendo todo lo que es rápido de comer, sorry.
Ya.
Este,
No sé, 25 es. No, 25 porque compré otra quesadilla y
¿y
eso.
qué costó $40 ahí en Chávez?
Ah, no, no. Pero no.
Porque veo ahí $40.
Sí, así que no, la pura carne no fue con otra quesadilla.
dijo, si quieres te comes el choclo. Oye, ya está caliente.
Cuando estás desesperado, cuando nada obtienes.
No, pues. Mira, ahorita cómo están los venecos, los colochos.
Mira, tú tranquilo, no esperando ciudadanía, tiene más rápido que el tío Rojo, que está obsesionado.
El tío Roque no tiene ciudadanía, ya sabes por qué, pues, compadre.
Ah, por
No,
pericote,
no le han metido las manos, que es el cagado.
por cotillo.
Le mete las manos y ya está cagado.
La mano ¡zas! También por eso te cagas, por acosador. Por estas 2 mañas que cagas.
Mala costumbre, ¿no? De los cagas. Por más que el hombre le sacuda ahí.
Sí, sí. Ya lo dijo el Rockefellercillo. Una regla con choro.
Pues otro hijo rico.
Le dijo la firme. Telling the truth, bro. Deja esa maña.
Esta mañana nunca la deja, compadre.
No, está difícil.
Ya eso puede ser algo que se pega, ya. Lamentablemente, no. Solo te arrepienten cuando están en problemas, pero después otra vuelta, cuando ven la oportunidad, ¡pam! Mierda. Eso no tiene cura.
Donald Trump, ¿no? Puta.
Ya llegó al poder, ya la gente le dio el poder, pues.
No gringos, pues.
No, los hispanos también,
Hispanos.
¿no? El mismo agradecido ahí el voto hispano.
Después que habló peste de los hispanos.
Le agradece y después le tira una patada al estilo. Estoy viendo que han votado los patas por la hueva, ¿no?
No sé qué me está mandando acá una chica.
¿A ti?
Sí, dice que mi micrófono está prendido.
Hello, everyone. Good evening.
Hello, instructor.
Hello. Everybody, please turn your cameras on. Excuse me. Okay, once again, everyone, there's only one student who has a permission to keep the camera off. Everyone else, please turn it on so that we can start the session. I'm just waiting on you guys. Consuelo, Christy, could you please turn your camera on? Fabiana, Karina, please, everybody. Let's not waste time anymore. Please turn your cameras on and we'll start. How the study is going? Everybody's doing all right? Yes?
A lot of medication. Just a lot.
A lot of medication. Yeah,
Cardiovascular system is huge.
that I agree. Yeah, these are especially cardiovascular. They're kind of quite a bit and complex. They get mixed up real quick. And there's a lot in your diabetes chapter as well. So these are heavy chapters. But remember, heavy chapters usually are where NCLEX wants you to know because they are very common conditions, right? What they want you to prepare for, what you're gonna face, right? Diabetes. Like you go anywhere, it's getting crazy. And mark my word, remember this, you guys will be in the field soon, right? After 10 years, see how this changes. You see everybody around you diabetic. Because remember, what is output based on? Input, right? Output is based on input. So input is going wrong, and that's what's going to happen to the output. It's already, it doesn't look good, but it unfortunately, very unfortunate, but seems like it's going to get more worse. That is going to create more issues. You know, your chronic kidney disease, okay? That'll be a big issue. Cardiovascular issues. These are going to be big things because of diabetes. Diabetes, it's a silent killer. It just sits in there. People don't realize every day how much harm it causes until it just erupts, something pops up. But this is what we're heading to, unfortunately. All right, guys, you ready? Yes? All right. So let's rock and roll. You guys had coffee, tea, something? Yeah? Stay awake? Yeah, okay. I saw Katerina showing the cup. Yeah, here's mine as well. Right now I am feeling slightly better, but today is day number 10. Day number 10, nonstop, 24-hour migraine, nausea, vomiting, crazy, nothing helping. So I got the shots today. I had to take a shot after your session. I didn't take it because otherwise I would have been knocked out. Just trying to push. That's right now. It's bearable, but these 10 days were quite exhaustive, and body's saying like, help me, but it just a little too much this time. Okay. All right, guys, let's move on. Okay, let's move on. I'll try to push myself as much as I could. All right. Okay, first question. So this is about digoxin for a patient who has heart failure. Right? It's a cardiac glycoside, correct? Which assessment finding requires to hold the medication. Now, to hold the medication, you need to know, okay, what are the risk factors, when to give it, what not to give it, that kind of stuff. Okay, please everybody try to, even you know it, don't stay silent. Please type your answer in the chat, okay? Excuse me. Okay, good job. So you're absolutely right. The correct choice is A. Now, do we know the reason behind it, why we selected that? Yes.
It can bring the heart rate more down if you give the medication.
Yeah, and does anybody know what is the line, the number, the magic number below which
60,
you should not go?
60 beats per minute.
Perfect. Good job. Good job. Yes, proud of you guys. Below 60, remember, anytime the doctor below 60, you're gonna hold the dose, call the doctor. Okay? Why? Because you're super nurses, and super nurses do what is safe. We play safe. So we do not want to hurt the patient. If you administer the dosage, it's gonna drop patient at risk. And that's what NCLEX want. Do not put your patient at risk, keep them safe. Okay, so it's a cardiac glycoside. Do you guys know how it works? Anybody know how it works? I have a question as well. So if you want to answer that, here you go.
B.
Absolutely correct. Yes, B is the correct one. It's a cardiac glycoside. You can think general. Strengthens the heart. Okay, if you make your heart more stronger, what it's gonna do? It's gonna increase properly the strength, right? So strength, what does the heart do? Contracts, right? It's a pump. In order to pump the blood, it needs to contract strongly so that it can push all the blood out. And that's what this drug does. It's clear to everybody? And it does this action by inhibiting the sodium-potassium pump. Okay, by doing so, increase in the intracellular sodium level, which promotes calcium influx into the cardiac cells. So the increased calcium concentration, that's what enhances the contractility of the heart. And that action is called positive inotropic effect. Have you guys heard about ionotrope, chronotrope, dromotrope drugs? Anybody heard about that? Okay, Catherine, you said yes. Anyone else heard about that? Okay, so there are three different classes of drugs, okay? Ionotrope, chronotrope, dromotrope, and each section has positive and negative, okay? Positive dromotrope, negative dromotrope, positive chronotrope, negative chronotrope. So the positive increase, negative decrease, okay? So this is a positive inotrope. It will strengthen the myocardial contractility, but now what a patient is suffering from a condition, when heart is doing a little too much, you want to slow it down. Those will be negative inotropes, okay? Then the chronotropes are, chrono is what? Chrono is a dial. What goes on the dial? Time, right? How do we measure the time? Hour or minutes, right? So time. Now in the heart, what goes along with time? The heart rate, right? So positive inotrope increase the heart rate, negative will decrease the heart rate. So that's how these things work. So I just wanted to kind of give you a little bit more detail. Excuse me.
I'm sorry, Professor. So the digoxin, it will be the negative
No,
chronotropic
positive.
effect? Positive.
It's a
Okay.
positive inotrope. Remember,
Got
it increased the force of contraction.
Okay. Thank
Okay.
you.
You're welcome. Now, why I'm putting this question here? Because digoxin is what? A narrow therapeutic index drug. Remember, I shared those resources with you guys. Have it, right? I sent it again to you guys. Correct? Which has like mnemonics and the list of drugs with narrow therapeutic index drugs, antibiotic and all that, right? So digoxin is listed there with the drugs which has narrow therapeutic index. The reason, once again, the drugs with narrow therapeutic index has a very small safety window. They can be toxic real quick. So we need to know the basics behind how to monitor them. All right. Good job, guys. Proud of you. Very well done. Everybody answered correctly. A is the correct choice. Now, does anybody know what's the normal values?
0.5 to 1.2.
0.5 to 2.
It was 0.6 to 1.2.
Now they're different. Always remember this thing. You may find a little bit deflection, a variation in the values in different resources, okay? Excuse me. Stick to something which makes sense. If it says, some say 0.6 to 1.2, some may say 0.6 to 2. If it's beyond that, just be clear that that's a toxic range. Okay, usually NCLEX, they don't go on the higher end. They just go slightly higher than or somewhere in the middle. So it's a very less chance they put you in a situation where you're like, oh my goodness, it was both and this is the higher end. Is it right or not? Very rare. They usually make it real clear and go a little above the that window, so that it's clear. They don't try to confuse you on those things. Okay. Some you may say 0.8 to 2. Okay. Here is the next one. And this is also about digoxin. There are a few questions about digoxin because I wanted you to understand the whole concept around digoxin. If somebody is on digoxin, you're providing them education, will lab value. Now remember here, read it clear. Which lab value is not essential to monitor, okay?
Professor,
Yes.
sorry, I cannot leave a message in the chat. It just says I am no longer a participant.
Have
Do you
you,
have an option to?
no, I don't actually, I mean, I came across some students previously as well. Usually, if you haven't accepted the invite for the meeting I sent,
Oh, I did click the same link you provided in the
No,
email.
no, not clicking on the
Okay.
link. When I sent
Oh.
the invite, if you click on accept, I most likely that will resolve the problem.
Okay. That's
Okay.
fine though.
Yeah, I have seen
Yeah,
this
because I
issue
wanted to
in.
leave an answer in the chat, but it's all right.
Yeah, I don't know, maybe
Thank you.
on your computer, maybe you wanna open up your email, look into that email where you had that invite for the meeting, the session, click on
Okay.
accept, okay, and then refresh. All right.
All right. Thank you, Professor.
You're welcome. Okay, guys, so here we got kind of mixed answers here. So let me go over this, okay? And why is that important? The correct answer is B. Now, there might be more than one correct here, but we need to see like, okay, what is more important, what is not more important, what, in questions, they may throw in this way, which is not important. They may throw what is important. They may give one correct, they may give more than one correct, and they may say, what is the priority? So which is more important? Okay, that means you have to look into what has a higher risk. So here, B is not important here. Calcium is not important. But whenever your patient is on digoxin, it's important to monitor serum potassium level. Very important. Okay. So make sure anytime your patient is on digoxin, you monitor the potassium level. Reason? If the potassium goes low, hypokalemia, right? Potassium goes low, it will increase the risk of digoxin toxicity. And that is the whole reason we are trying to monitor so that we can prevent the toxicity. Okay, so potassium levels, monitor them. Now, magnesium can also impact, but not up to that extent. Okay, so potassium is the highest priority. But the question here is about not. So that means calcium. Calcium is the only one which you don't need to monitor when your patient is on digoxin. Okay, but know both things. What you don't need to monitor, what you need to monitor. Okay. I created this question. What if NCLEX give you a question where you need to know the lab for potassium because related to digoxin question they can throw on and see if you can identify the correct choice.
Professor, sorry, can I interject for a second?
Yeah.
See, for the previous question, I was a little bit confused. And the reason why I chose magnesium because one of the video, what I think was Picmonic, I read few of the labs that you need to monitor is sodium, calcium, potassium, which are three main. So I was wondering, magnesium is not a part of it. But when you mentioned the calcium, we don't have to monitor. Could you please explain why we don't need to monitor calcium?
Because calcium does not change digoxin levels, and we are monitoring to see if the patient is experiencing drug toxicity from digoxin, and all others can impact the concentration or the amount of digoxin, and which can put your patient at high risk of toxicity for a drug which already has a very narrow therapeutic window. Make sense?
Okay. Yeah, it does. All right. Thank you, Professor.
All right. You're welcome. All right. So now here, majority of you answered correctly. There's some answered differently, but the correct choice is C here. C. Anybody knows what is the normal serum potassium level?
3.5.
3.5 to 5.0.
Yeah, 3.5 to 5. So if you know the number, well, here is the answer right there. 3.8, between 3.5 to 5. perfectly fine, right? But if they give you 4.0, the 4.1, well, that's where you need to tell the doctor. Okay. In these kind of questions, ask yourself what this drug is used for what system, and what system it is, what it does, what's happening in the system, and you will go close to your answer. Okay, good job again. Yes, B is the correct choice. Okay. Now, sometimes they give you heart rate, sometimes they write rhythm, sometimes both, or they may say, pulse rate, or they may say apical pulse. Okay, these are all related. The reason we want to make sure it's safe to give this drug to the patient, right? Because we know the number below 60, no, no, and no. So always know this heart rate is normal, the rhythm is normal, the pulse is normal. Usually they say like apical pulse for 1 minute, and that's how you determine if it's above 60 or below 60, and if you can give it or you cannot give it. Okay, is everybody clear? Any questions so far? Yeah, go ahead.
Yeah, I just had a question. So a lot of my digoxin orders will have a parameter for the heart rate, but also a parameter for blood pressure.
Yes.
So it will be either or. So if the blood pressure is below 110, you don't administer it, and if the heart rate's below 60, you don't administer it. So
correct.
And
yeah.
A is too, but I know the medication, the main purpose is for the heart rate and rhythm, but it can affect the blood pressure, can prevent you from giving the medication.
That is 100% correct. And based on patient's underlying condition, those factors could be important. Okay, so that's why you don't see the same instruction for every patient for the same drug. Patients' underlying conditions, what else they are taking. Now, if they are taking another antihypertensive, well, it can put them at a much higher risk as compared to who's not taking it. So there are many factors which can determine the instructions, the guidelines for that patient, that when to hold it, when to give it. Okay. A good point. Good job. All right. This should be an easy and breezy. Excuse me. Okay, some of you guys, your camera's still off. I'm sorry, I don't want to keep saying this, but we don't want to interrupt everybody's learning here. So please, if you don't have approval, please turn your cameras on. All right, good job. Yes, C is the correct choice here, right? C, hold the dose, call the doctor, because it's below 60, right? Okay, now, we're talking about digoxin. Yes, it is a high risk. The labs to monitor. What if you're not looking at the lab, or you're looking at the patient? Or you're talking to the patient? What can give you an indication, a possible indication that patient might be experiencing digoxin toxicity? And for digoxin, it's important to know because it's one, neurotherapeutic, high risk. Second, it's more unique as well. So those kind of NCLEX likes to ask. All right, so pretty much everybody answered B, which is correct. Bradycardia and visual disturbance. Non-visual disturbance, anybody know? Like what kind of visual disturbance?
Hollow lights around the object. But a color vision.
Yeah, good job, good job. Yes, that's what I want you to know. So there are different kind of symptoms, from mild, moderate, severe, very severe. Visual disturbance is real important about that. So they may have blurry vision. They may have yellow, green hollows around objects. Okay. Altered color perception. These are really important one. Some patients may have like nausea, vomiting, that confusion, that kind of stuff as well. Okay. Okay, now, what if you determine the patient is experiencing toxicity? Then what we're going to do? As a super nurse, you need to give a solution.
Antidote?
Yes, so now let's look into which option. Looks like you're able to type now.
Yes, I just figured. Thank you, Professor.
Okay. All right, guys. All right. Perfecto. Yes. So C is the right choice. For digoxin, it's digoxin immune fab, or brand name called DigiBind. Given a patient experiencing severe digoxin toxicity. Okay, and it helps excretion through kidneys. Okay, perfect. Another one. You're educating a patient being discharged on digoxin. What requires further teaching about any potential drug interaction? Usually NCLEX throws these type of interactions in two ways. One, which can increase the risk of toxicity. The other is the drug, the second drug can decrease the efficacy of the drug. And whenever these are narrow therapeutic index drugs, it's pretty much almost all the time related to the toxicity, which can increase the level of the drug. So here it's C. Correct choice is C. Good job. Okay. So let's talk about another drug here. This diltiazem. There's another one in that class. What's the other drug in that class which goes along with diltiazem?
Verapamil, something like that.
Verapamil, yeah, diltiazem and verapamil. So they're in the same boat. Come on, everyone, please answer. Please try to kind of answer in about 30 seconds or so, 30, 35, so that we can cover more questions. So the correct choice is D. Good job on that. They cannot stop taking the medication once the blood pressure improves. No. And everything else is correct. Everything else is correct. Okay. Now let's go over some drugs for your cardiovascular system, okay, for your heart. So nurse educating about ACE inhibitors, right? Let's see if we can identify which ones are ACE inhibitors. Sometimes the question they give you, it's a stepwise approach. First, you need to identify what they belong to, okay? Recognize them, and then like how they work. And that's when you can determine like what is the correct choice. Okay, good job. Yes, B is the correct choice. Pril, they end with pril, right? Everybody clear? Pril, all prils, they're ACE inhibitors. Now, second thing is, well, how do they work? We know that we give it to patient who has high blood pressure, but how do they decrease it? Nice, nice. Okay, perfect. Good job, guys. Yes, B is the correct choice. Now, there's angiotensin 1 and then there's angiotensin 2. Angiotensin 1 gets converted into angiotensin 2, which is the troublemaker. Angiotensin 2 is a vasoconstrictor, and that's what increase the blood pressure. Remember, vasoconstriction increase the blood pressure, vasodilation decrease the blood pressure. And angiotensin 2, that is a vasoconstrictor. And by blocking the conversion of 1 into 2, we are keeping the blood pressure low. Everybody clear? Any question? Okay. Now let's talk about a few more important aspects. Your patient on ACE inhibitor for hypertension. Which statement do you think patient maybe need more clarity for the teaching? Well done, well done, well done. Yes, good job. Yeah, D. Once again, first dose syncope, it's common with some drugs, antihypertensives, especially alpha blockers, and with Zosyn. So they don't need to stop it, but all other are the correct aspects of ACE inhibitors. Their risk of developing non-productive, the dry cough with ACE inhibitors, okay? If it's severe, sometimes patient can't even sleep at night, and you may need to switch it to another class of the drug, right? So if they develop that, they should know that that's something to report, okay? You don't use like salt substitute which contain potassium once again, when you use that, ACE inhibitors can increase the potassium level. So if you are using other substitute, then patient will experience hyperkalemia. Right? If they have any swelling, left face, angioedema, well, they need to report that as well. Okay. Next. Let's try to answer real quick. I'll pick up the pace a bit. Come on. Okay, excellent. Yes. Potassium level. Now, what is the risk? Low potassium or high potassium? Hypokalemia or hyperkalemia?
Hypokalemia?
Hyper.
Hyper. Okay, good job. Okay, let's talk about ARBs now, angiotensin receptor blockers. Let's identify real quick. Excuse me. Okay, everyone, please try to answer. Okay, great job. Very well, guys. Yes, B. Remember, ARBs, they end with sartan, okay? ARBs end with sartan. Okay, let's talk about a few important things about that. What is the mechanism of action? We know about ACE. Now let's talk about ARB. It's slightly different than ACE inhibitors. ACE, they block conversion of 1 to 2. ARBs don't do that. They just don't let the angiotensin 2 bind with the receptor. Okay, so they block the receptors. So B is the correct choice. Good job. Okay. Another one about ARBs. It's regarding the black box warning. And black box warnings are high risk. So let's see which requires further teaching. Okay. Okay. Majority answered correct. A couple which are not. But let's know about it. Now, always remember whenever I say you like, okay, and you always ask like, okay, what should I focus on? And I always say, first thing is know what you should know or what is important about that drug. Everything is not important about every single drug. Now, in the previous one, ACE inhibitors, I told you about what? Dry cough, right? Non-productive dry cough. And also remember that can also cause angioedema. Like, patient may have like a fluid buildup here, like swelling around the eyes and stuff, okay, or the lips. That's also important to know. But in here, important about ARBs is not what was important about ACE. It's not safe to give in pregnancy, especially second and third trimester. It's a black box warning. It can cause fetal harm. So it's a no. Moving forward, let's talk about calcium channel blocker now. Do we know what are calcium channel blockers? Which one are? Can we identify them real quick? Okay, yes, good job. C, they end in pine, okay? Pine. So C is the correct choice here. Now, how about the mechanism of action? How does it work? The name say calcium channel blocker. Okay, great. Excellent. Yes. B is the correct choice. Remember, find the keyword. Find the keyword. You know it, they're saying it's calcium channel blocker. So, hey, what they block? Calcium channels. Find the calcium. B right there. Calcium channel. Right? Okay. Now, what adverse effects associated means one of the common ones with calcium channel blocker? Now remember, whenever I tell you, they may ask you the most common adverse effect, they may ask you most severe, or what is the priority? What does it say here? Common. Okay, so A is the correct choice here, okay? If they ask you the most common, it's constipation. What can you do? Tell the patient to increase the intake of fluid and fiber, right? If they ask you severe, well, then you go to C, orthostatic hypotension, okay? You get that? So these are tricky questions. You know the content, but how they word it, that changes the whole scenario. So read carefully. All right. Now, it's same calcium channel blocker. What do you think? In which of the statement, when they don't have clarity, it needs further teaching? Come on, come on, come on, everyone. Okay, yes, correct. D is the correct choice. D is the correct choice. Reason?
They need to get salt substitute, not avoid them.
Yeah, if they're taking calcium channel blocker, there's no need to avoid the salt substitutes. That everything else is correct. They shouldn't consume grapefruit juice along with that because it can interfere with the metabolism of calcium channel blocker, right? How? It can increase the level of calcium channel blocker. That means too much drug means they're at risk of adverse effects, right? Wherever you see alcohol, well, that's the right thing. Always safe choice, avoid it, right? Okay, all right. Let's identify beta blocker. Okay, yes. C is the right C, okay? Right choice. C is the right choice. They end with LOL, okay? They end with LOL. Let's look into a couple of important questions regarding beta blockers. Let's see if you can find the right one. It's a mechanism of action of beta blockers. Once again, the name beta blockers. Because if you look at A, it says beta blocker directly stimulate. No, you don't stimulate, you're blocking here. That is not the right one. B is the correct choice here. They block the effect of epi and norepi. Remember, what beta blockers are used for? Blood pressure, right? Hypertension, blood pressure is high. And these two gentlemen, epi, norepi, what they are? Vasoconstrictor. And what happens with vasoconstriction? Blood pressure goes high. And when you block epi and norepi, what's going to happen? Blood pressure is going to go low, right? That's what they are doing here. Okay. Next. So patient is on beta blocker. Which condition? High risk here. Or who should not be using them? Perfect. Yes. Good job, guys. I'm very proud of you guys. Well done. Yes. Now, asthma as well as COPD. Okay. Just remember respiratory issues. Severe respiratory condition, asthma, COPD. It's a no-no. You guys know why?
They can cause bronchospasms or.
Yeah, and cause bronchoconstriction as well. So in the respiratory tract, the patient will have hard time breathing. And if the patient is suffering from asthma, COPD, what is the problem? Breathing, right? It's the lungs, and that can make it worse. Perfect. Okay. Now this is select all that apply. Okay, so more than one, correct. Okay, come on, please. I just only see 10, 12 answers. Please, everybody, try to answer. Okay, so looks like everybody answered A and D. Okay, A and D. They are both correct, but there's another one. C is also correct. Okay. We know decrease the heart rate, so you're reducing the stress on the heart, right? Increasing cardiac output? No, you're not trying to increase the cardiac output here. See, reduced myocardial oxygen demand. Now, when your heart is working hard, right? Or let me give you a common example, which fits on all of us, right? So if you are not doing anything on a certain day, you usually feel like maybe less hungry. But if you're working hard, you're kind of, going to the gym or kind of going for a run or doing something that you are spending, right? You're spending energy, right? Energy comes from food. So if you're spending more, you need more, right? You need more. Same here. If heart is working hard, they need more food. What is that? They need oxygen too, right? The heart itself, its muscles, they need oxygen too, myocardial oxygen. So when they're working hard, the demand is high. Now what you're doing, you bring it on to ease. You're telling, hey, take a deep breath, slow down. Okay, just slow down. And by doing so, you're reducing the myocardial oxygen demand as well. Okay, so it's A, C, and D. Okay, next. Okay, please try to answer quick. These are alpha blockers. They're used in old men, usually after 60, 65 patient, they develop a condition called BPH, benign prostatic hyperplasia. It's like you know, a clamp on a garden hose. Now you turn the water on, but now the water is dripping because there's a clamp on it. And the clamp here is what? The prostate gland. So it squeezes the urinary passage and they're not able to urinate. These patients, it's inconvenient, painful. They develop a lot of UTIs and that can go up to the kidneys, pyelonephritis, that kind of stuff, okay? Old males. And these alpha blockers, these are the ones which are given to those patients. What they do, alpha blocker, they cause dilation, vasodilation. They open up the passage. All right. So tamsulosin, B, they end with losin, some zosin as well. Okay, next. MO, mechanism of action of alpha blockers. They're also called alpha adrenergic blockers. It's the same thing. They're just trying to give you a hard time, making a more complex name. Come on. Okay, yes, pretty much everyone except one. Everybody answered correctly. C is the correct choice here. They block the alpha adrenergic receptor and cause vasodilation. Vasodilation. Now, remember, even if they are given for hypertension, they're given for BPH, whatever you're giving it for, or any drug, one drug could be given for different conditions, but how they work is not going to change. Adverse effect never going to change. Always remember that as a class. Okay, so let's look into that factor. Excuse me. Now, what are the adverse effects here? I should rise slowly when standing to avoid dizziness, fainting. Is that a risk with this drug? Yes, right? Because what does it do? Causes vasodilation. Vasodilation brings blood pressure down. Now, somebody sitting or laying down, just trying to stand up, blood pressure drops. Okay, that's a high risk. Patients can fall. So, well, that is correct thing. I'll call my doctor if experience chest pain or irregular heartbeat, anything abnormal. Yeah, they should call. I can take this medication with alcohol to help me relax. What did I tell you about alcohol?
No.
No. Everybody says, oh, no, right? So C is the right answer here. All of the choices are the right statements, but that's the only wrong one. Okay.
Professor, just one
Yes.
question. Is that the reason why we advise patients to take tamsulosin at bedtime?
That's why that's what I mean. Can you repeat the question? To take it or not take it?
Should take it at bedtime.
Yes, to take it at bedtime because that's when the least chances that they're gonna wander around, right? At night, usually they try to sleep, right? So that is the reason we give them at night. And this drug always, the first dose, the patient can develop a condition or it's called first dose syncope. The blood pressure, boom, down, real bad. And because it was the first dose, even patient didn't know, the doctor didn't know, you didn't know like how the patient is gonna react to the drug, respond to the drug. So that is the reason always give at night and tell them don't move out of your bed after taking this medication. Let's see how your body reacts to this medication. So stay on your bed. If you need help, press the button, right? All right. Okie-dokie. Now let's talk about some other cardiovascular drugs like your statins, okay, for hyperlipidemia, high cholesterol. So they're asking which one requires further teaching. Okay, please everyone try to answer quickly. We are at slide, I think 31, and we got like 87 total. So 56 slides and 6:30 already. Okay, good job, guys. Yes, C is the correct choice here. The reason alcohol damages what?
The liver.
Liver. Statin damages what?
The liver.
Liver. Now, two things which can damage liver, increase the risk.
Liver
That's
toxicity.
why. That's why we're telling them. All right, everything else looks good. So the correct answer is C, that request for the teaching. Okay. And this is usually the first step. If the patient is not extremely high risk, where you may have to treat them aggressively, that's the first thing. Lifestyle modification, right? Lifestyle modification. Good job. Yes. ABC is the correct one. Exercise is real important. None of the drugs, alone can fix this issue. They need to change what they eat and drink and in their activity level. Very important. Should tell them more fruits and all that, the whole grains, and then smoking cessation is always important. You assess them and you educate them, you provide them resources. That is real important. Okay. Now,
Professor, we can't do wine every day.
sorry, what is it?
So 1 cup of wine every day, not good. Just want to make sure.
Okay, let me be clear. Any amount of drink, alcoholic drink, not any amount is safe. Okay, now different studies will tell you different things. Okay, but it's a very vague thing, very wide open field. You cannot generalize it. That one drink can impact you differently, me differently, the other one differently. So when I come across all the time, people say, oh, I just read, look here, it says like this, up to this amount is good. So for who? That is $1 million question. It doesn't apply to everybody in the same manner. You have to think critically, practically. These things you read in papers and social media, this and that, it's all crap. Nothing applies in general. You have to individualize it. How is going to impact this patient, for that patient individually. Okay. Excuse me. All right. Now, B is the correct choice here. Good job. Diuretics, diuresis, they're going to increase the output of urine. So your patient is going to lose more fluids. Along with fluids, always keep an eye on like electrolytes levels and all that, because the water going out, urine, it takes them too. You just say, hey, I don't want to go alone, so join me, right? So always monitor that. So B is the correct choice here. Okay, how about this one? Okay, once again, wonderful. Good job, guys. I am proud of you. Well done. Yes. C, remember here, certain drugs can put your patient at increased risk. For example, here, spironolactone. Now, spironolactone is what? It is a potassium-sparing diuretic, right? So it let go the volume, the fluid, the urine out, but it holds on to potassium. Now, if it's keep holding the potassium is going to go high, causing hyperkalemia. So that is what we need to monitor, whatever the risk for, right? Okay. Any questions so far, guys? Everybody okay? Yeah, please feel free to ask anything which you're not clear about, okay? I want you to learn. Okay, next. Now here's furosemide. Furosemide is Lasix, right? Furosemide is Lasix. This is also a diuretic. So which food drink should the nurse recommend to help prevent common side effect? Well, looks like everybody asked it. Yeah. Okay. Nice. Yes. A, bananas. What does banana have?
Potassium.
Potassium. It's the same concept. Diuretics, they are pushing things out, not just water, other things, and potassium can go down with this. Okay. Okay. Now, it's a common concept, but important point in patient education, like when to take it. Just think practical, common sense. Perfect, perfect, perfect. You guys are pros now. All right. Yes, super nurses are rocking. Good job. C is the right option here, but incorrect statement, right? Should never tell them to take it at night. When should they take it?
In the morning,
And why?
because they will be going to the bathroom.
Yeah, because diuretics, they're gonna push the fluid out. So where it's gonna go? They need to go to the bathroom. And if they take it at night, number one, they're not gonna be able to sleep. Number two, think about it. If the patient is old, sleepy,
Fall
maybe
risk.
taking some medication. Sorry, what was that?
Fall risk.
Fall risk.
Fall risk, hypotension as well. Hypotension and fall risk. Good job. Okay. Patient has angina pain. Okay, angina pectoris. Rate 6 out of 10 during physical activity. You guys aware about the stable and unstable angina? You guys
Yes.
know? Yeah. Okay. Okay, great. Yes. Nitroglycerin. It's used for acute, the sublingual form, right? Or the spray nitrolingal. So it causes dilation. Vasodilation, increase the blood flow, more oxygen, right? More blood, more oxygen, nitroglycerin. Now, there are a few things to know about it. What is the protocol of taking the nitroglycerin sublingual tablet? Somebody's experiencing angina pain. Well, are we able to correctly teach the patient? Does the patient understand how to take it correctly? What order?
They need to take it every 5 minutes, I think 3 times. Doesn't go away, then call 911.
Well, but there are 3 options here, which has 5 minutes in that.
Oh, no.
All right, good job. Yes, everybody, majority have answered correctly. B. Now, let's talk about important things. First of all, how many tablets they can take? Max 3. Okay. Interval every 5 minutes. Okay. Now, what other things comes in between? First is that first tablet as soon as they experience the pain, right? They take it. Now we know that the second is a 5-minute interval, right? So what they do in 5 minutes, they wait. So now we know that after 5 minutes, they can take another one. But what if the condition worsens quickly and they're not even able to call 911 after that? Who knows? Nobody, right? So what do we tell them? Call 911 first before you take the second dose. So take first, wait 5 minutes. Now, if they still experience pain, call 911, take the second one. Make sense? That's the correct way of doing it. Then wait another 5 minutes. If they're still experiencing pain, they can take the last one. And that's it. The only thing they can do after that is wait for people to come and help, right? The emergency crew. That's all. And always tell them, don't drive after taking these 3. Hypertension.
I have a
Okay.
question, Professor.
Yes.
If they,
I have a special sale, okay? Buy one, get one. So you can have 2 questions.
okay, so if they take the first dose and then they get better, do we still give the second dose?
Okay, so if the pain goes away, then they don't need to take it.
Do we call 911? No, right?
Okay. Excuse me. No, if the pain goes away, then no. But you tell patient monitor. Okay, if the pain comes back, they need to call and then take it.
Thank you, Professor.
Well, Professor, can I add
Yes.
on that question? So for example, right, the patient take the first dose at 7 p.m., just example, and then the pain go away. And then 1 hour after that, they have the pain again. So do we consider that as the second dose or first dose again? When they
No,
take
we're
the
gonna consider it the second dose.
second dose, okay. So
Yeah.
anything after that will be considered a second dose of nitro.
Correct. So,
Okay.
but if they're saying like, after 8 hours it's happening, no, not that case. But if it's within 30 minutes, an hour, or, it's closer, then we're gonna consider in that same zone, same time. Okay.
Thank you.
Excuse me. Okay, next. This is about the patch now. So nitroglycerin patch. It's a different formulation. Now, how to apply that? Okay, please try to answer quick. Yes, B is the correct choice here. Yes. So a few things. First, now it's a topical application, right? Patch. So in order for the patch to work, it needs to get in touch with the body, right? Properly. And stick to that. So if there are hairs and other things, or somebody has a lotion on it, it's not gonna stick. So always on non-hairy area, okay? Non-hairy. And you should never like shave it. If you have to get rid of it. Hairs always recommended is like you trim it. Okay, you will see patients in practically doing these things, but for NCLEX, that's what it is. So non-hairy area, on chest or back or shoulder, right? And this patch should not be on for all day or for whole 24 hours. This patch should be taken off for at least 10 to 12 hours. Some resources say 8 to 12 hours, but somewhere there around 10 to 12 hours should have an off period. The reason, the body gets used to it, develops tolerance, and then the patient does not feel well, even the patch is on. Okay, so they need the nitrate-free period. And always rotate the site of application. Okay. Next. You're monitoring patient who's on nitroglycerin, adverse effects. So immediately report means they're saying the most severe one, high risk one. Okay, come on, everyone. Okay, yes, C is the correct choice. Causes vasodilation. Vasodilation causes hypotension. So hypotension is the biggest concern here. Okay. Headache could be like common, but the biggest concern here is hypotension, and it's a big thing here with this drug.
Oh,
Ooh, who's that?
oh, sorry.
Come on, Denise. I make everybody sleep. You're in your own comfy little dark zone, right? Excuse me. Okay, everyone, please answer. I don't see many answers. Guys, come on. I hope you're not sleeping. Okay, yes, B is the correct choice. This is a big interaction, guys. Always remember these ED drugs, erectile dysfunction drugs, sildenafil, vardenafil, tadalafil, these all, it's a big no with your nitroglycerin or patient will be in huge trouble, severe hypertension, because they're both vasodilators. The patient takes it together at home, well, you will see them soon in the emergency department. Did you work today, Jared? You look tired. Yeah? All right. Okay, guys. So B is the correct choice. Yes, amidrone. Tachycardia, bradycardia, that's arrhythmia, right? When the rhythm is not normal, that's arrhythmia, right? So tachycardia, tachy means faster. So heart is beating faster. So that's when you're giving antiarrhythmic drugs, which is your amiodarone, right? Atropine, on the other hand, is used when the heart is beating slow. Bradycardia, right? To make it faster. Correct? Yeah, okay. Come on, come on, come on, come on. Let's move faster.
What was
Let's
that last
move.
one? Sorry.
Amiodarone. Okay. Excuse me. Alrighty. So, patient is cardiac arrhythmia history, which the founder is classified as antiarrhythmics. Okay. So your amiodarone we just talked about is adenosine, which is used for PSVT or SVT, supraventricular tachycardia. Then your metoprolol can help that, right, by reducing the heart rate. Then your digoxin, right? Digoxin is not a traditional antiarrhythmic class drug, but used commonly to control the rate in AFib patients or heart failure patients because it can increase the vagal tone and slow the AV node conduction. Okay. Okay. You're educating patient about potassium channel blockers. Which one are those? Come on, come on, come on, guys. Come on. No, guys, D is not the correct choice. D, furosemide is Lasix. That's a diuretic. It's not a potassium channel blocker. Lisinopril is what? ACE inhibitor. Metoprolol, LOL is what? Beta blocker. What is left? A, amiodarone. That's a potassium channel blocker. If you don't know the right answer, well, look for what you know about and start crossing them out, and you will find the right answer. You probably didn't know about potassium channel blocker, but you know about ACE inhibitor, you know about LOL, you know about Lasix, so cross them out. You're left with amiodarone. Okay, next. Which ones are the sodium channel blockers? Good job, guys. Yes. B is the sodium channel blocker, lidocaine. They're antiarrhythmic drugs. Good job. Okay. All right. Now somebody, high cholesterol level, right? Which is the first line?
Oh my. Wow.
Okay. So the first line. What are the first line? Statins are the first line. Okay, first line drugs. Not the first line treatment. If they say like what to recommend first, well, that's a lifestyle modification. But when we're talking about the drug, okay, drug, that is your statin. Atorvastatin, simvastatin, lovastatin, these are your first line, okay? Then how do they work?
Professor, sorry the question. So which one is the first line for the statin for reduce the cholesterol? I'm sorry, I missed your.
It could be any of the statins, but
Yeah,
and this question, it was atorvastatin. That was the only statin listed here.
atorvastatin. Okay,
Atorvastatin, yeah.
okay, thank you.
But it doesn't mean atorvastatin is the first line because it is a statin, one of the statin, and that's the only one listed. They may put like simvastatin or some other drugs, but what I'm saying is this class of statin are the first line drugs.
Okay, thank you.
All right, so the correct choice here is C, okay? Now, another name for statins is HMG CoA reductase inhibitor. That's the name, okay? Why? They inhibit HMG CoA reductase. What is that? That's an enzyme, and that's what the answer is here. Statin inhibit an enzyme involved in cholesterol synthesis. Liver synthesize the cholesterol with the help of HMG CoA reductase enzyme, and you block that enzyme and you're blocking production of cholesterol. Is that clear to everyone? Anyone who is still not clear? All good? All right, next. The patient can experience that and they can complain about that. So we need to know. Good job. Yes, you're absolutely right. B is the correct one. Muscle pain and weakness. Do you guys know what's the condition called? The severe condition related to that?
Rhabdomyolysis.
Rhabdomyolysis. Rhabdomyolysis. Good job. Good job. Good job. Good job. What happens with that rhabdomyolysis? What is
Muscle
that?
breakdown.
Yeah, good, good, excellent, guys. Okay, now let's see which labs to monitor. Okay, come on, everyone. Please try to answer quick. Hey, good job. Yes, B is the correct choice. Okay, creatine kinase, CK, and liver function. Remember, statins, you always monitor liver functions. If high risk every 3 months, or based on the risk associated, their age and all that, or what else they're taking. That's how the time frame could be different for different patients, like how often to repeat the labs. But liver functions are important to monitor. So does your creatine kinase. Why? Remember, we just talked about rhabdomyolysis, right? Rhabdomyolysis. So rhabdomyolysis can damage their kidneys, and the patient may end up going on dialysis forever, right? So creatine kinase, CK, that's why we're monitoring, right? So the reason, CK tells you what? Elevated. CK tells you muscle damage, right? And that's what the rhabdomyolysis. We're trying to prevent the organ damage. With me on that? Agree? Yes. All right. Next, there's another drug. It's not a statin. Ezetimibe, brand name Zetia. Very effective and very commonly given along with statins to reduce high cholesterol. How does it work? Yes, B is the correct choice. It's an absorption inhibitor, okay? It inhibits the absorption of cholesterol in the small intestine. Good job. B is the correct choice here. And I'm sorry, before I forget, I was going to tell you that the first thing today, but I forgot, okay? But I don't want to forget it. For the previous exam, your exam 2 last week, I came across a discrepancy. I was actually looking into every single question. And I found one option which was not correct in one of the questions. Okay, that was not appropriate. So it took longer because I had to discuss it with the dean and all. Like, you know, it's previously was different, but now multiple people who have to kind of get together and all discuss and then come up with a conclusion. But I recommended and they accepted it to give you guys one extra point for that because that was not appropriate. Okay, so
Thank you so much, Professor.
you're welcome. So that was not fair. That was not right. That's not your mistake. So that
Can
was
you tell us
not
the
the right thing.
question?
So probably
Please.
tomorrow I'll do that. Okay.
Okay.
Right. Everybody clear about that point? Any question regarding that? Like, no,
Wish
just
we
give us
knew that
one
before
point,
the
right?
exam, so I could have got my point 15.
I mean, it would be nice to know what the question was, to know what the mistake was, but I know that you guys can't discuss it, so it's kind of pointless.
I'll see what I can do. I cannot share the question, but I'll see how I can give you a little clarity about that. Okay, maybe when
Thank
we
you.
meet next time. Okay. All right. You're very welcome. All right, guys. So next year, let's move quick, guys. It's 7:02. I mean, I know we scheduled it from 5:30 to 7, but I want to. Are you guys okay staying longer? Yeah.
Yes.
Okay. Yeah. I mean, I'm just. I wanted to. Oh my goodness.
Professor, I might have to
go.
turn off my camera for a little bit because I got to get kids to bed and stuff, but I will be listening.
Okay. And just to let you guys know, please never feel uncomfortable. And I know that it's like, you know, again, everybody's different. But with me, never stress out if the kids are around, they show up on the camera and they're just doing things. It's okay. I understand that you have life, you have kids, everything. As long as you're learning, I mean, they just show up, it's okay. Okay. So don't stress about these kind of things. Just try to learn. Forget about everything else. Okay.
Easier said than done.
Right. Even I don't know, like when mine is, my little TV show up like, oh, my PS5 is not working. Oh, you know, that thing is not working. What happened to the Wi-Fi? Like, hey, like I'm teaching. Like, no, that's important too. Alrighty. So the correct choice here is C, guys. Black tarry stools. What does it tell us?
Bleeding.
Internal bleeding.
Bleeding. Yeah, bleeding. And DVT. DVT is risk of what? It's a clot, right? Deep vein thrombosis. And if you're giving a medication to prevent or treat the clot, means the risk is bleeding. Right? So always tell your patient about that. And hey, keep your eyes open. These are very high risk drugs. Heparin and all that. You gotta keep a close eye. And that also has a protocol, like your hypertension drugs or diabetic drugs, that kind of stuff. And that's the reason I have this question here. Excuse me. Usually this heparin, warfarin, these kind of stuff, they get mixed. What's their antidot, what lab to monitor. So I just want you to kind of have that clarity. So with your heparin, lab to monitor is APTT, activated partial thromboplastin time. So C is the correct choice. Okay. All right. Next. Know these things well, because you're going to come across these drugs and these are real issues. You're going to see them. So you should know this. Okay, yes. The antidote for heparin is protamine. So I always remember it in a way like, the computer brand HP. I know you're Apple generation, but mine, it was like HP, Hewlett Packard. So HP goes together. Heparin, protamine goes together. That's how I remembered. Okay. Now let's talk about another high-risk drug, warfarin. Okay, warfarin. And this happens patients when they are being discharged, they were in the hospital or they were in a rehab facility and they are getting discharged, and now they're given both, and so like, well, you just told me that these drugs can put me at risk of bleeding, and instead of one, you're giving me two. Why? Okay, wonderful. Good job. Yes, C is the correct choice here. The reason is you need the patient to be safe until there's enough warfarin to do the same thing, right? And it takes 4 or 5 days at least for warfarin to build up in the system. So during that, you have an overlap and both are given together. That is the reason. Okay, everybody understand that? Any question? Okay, now which lab to monitor with warfarin? We talked about heparin earlier, so that's warfarin lab. Okay. Yes, perfect. B is the correct choice. INR, International Normalized Ratio. Okay, INR. Okay, do you guys know what's a normal INR for a patient who's on?
2 to 3.
2 to 3. 2 to 3. So always know that, okay? Sometimes they give you these values, patient labs. So you have to open it in NCLEX and see like, okay, is it within the normal or is it something in the toxic range? Okay. How about this question? They're giving you an INR, you need to know, is it safe, less, more, or what to do? Okay, yes, B. And this how I used to remember is weak, WK, weak. W for warfarin, K for vitamin K. That's how I remember that. What is NNR? And usually these two get mixed, your warfarin and heparin. So just separate them, HP and weak. Alrighty. Okay. Because warfarin itself is a high bleeding risk drug, so we want to make sure patients understand that they don't take anything else which can increase the risk of bleeding. And usually older patients are on it, and the older patients, they try all kind of OTC products. So they saw an advertisement somewhere or somebody told them. So it's really important that we try to prevent that kind of errors, interactions, which can put your patient at risk. Yes, the correct choice is B, ginkgo biloba. It increases the risk of bleeding. Okay, echinacea usually used for like supporting the immune function. So it has nothing to do with valerian, has kind of calming, soothing, sedative properties, nothing to do with it. St. John's wort, it can reduce the warfarin level, not increase the level. And we are talking about increased risk of bleeding here, but it can reduce the effect. So it's better to avoid that as well. Okay. Now next is about heparin injection. There are a few things we need to know. Okay, good job. Yes. C is the correct choice. In the abdominal area, about 2 inches away from the navel, 90-degree angle, same like insulin, right? A few other things I want to mention here, which are also important. So it's sub-Q, right? It's not IM, it's sub-Q, correct? Subcutaneously. Now, do not ever aspirate, okay? Never aspirate. Third, never try to tap and try to push the bubble out by kind of pushing it upwards. Like in your insulin, usually injection, you see like you tap it and try to kind of remove the air bubble. Don't do that in this case because a slight increase, decrease in the amount of drug can change the risk your patient might be on, and it's not going to do anything bad. It's sub-Q, so don't try to remove the air bubble. Do not massage it. Do not apply heat on it. That'll change the absorption. Okay. Another thing. I'm mentioning it because one of the option it says like using a 22 gauge needle. That's not correct. You should inject by using a 25 to 27 gauge needle. Okay. With the 3/8 to 5/8 inches. Okay. The needle size.
I'm sorry, can you repeat the
So
gauge and the needle
20,
size?
yeah, 25 to 27 gauge and 3/8 to 5/8 inches.
3, okay, thank you.
Okay, you're welcome. All right. Now here, it's about corticosteroids, okay, steroids. What is the main primary effect? They're used for many things. What was the primary function? Excuse me. Excuse me. Okay, come on, everyone. Okay, looks like everybody answered correctly with option B, which is correct. Okay, corticosteroids, the main function is anti-inflammatory effect. Anti-inflammatory. Whether you're giving it for any respiratory condition, you get somebody has an injury that's an inflammation or something, you are trying to suppress that inflammation, the immune response. That's what you're trying to suppress. Okay. Okay. Now, if your patient has a condition where they need to take steroids for longer term, then we need to know, what are the adverse effects, what they should worry about, what they shouldn't, and then what to tell them, what to monitor. Yes, okay, yeah. Yeah, majority you answered correctly. Yes, Christy, you're right. So they should never be abruptly stopped. Okay. Have you heard about Medrol dose pack? You heard about Medrol dose pack? Methylprednisone tablets. So they're packed like there's 6 day one, then 5 the next day, 4, 3, 2, 1, right? So suppose you found somebody just saying, hey, like I don't have anything to eat today. Can you help me out? And you say, like, yeah, I'll buy you food. So you bought them breakfast, you bought them lunch, you bought them dinner, right? Now next day, you find that person waiting for you, and so like, hey, like I gave you yesterday, but you gotta come up with something. Like I can't just do that every day, right? So he's like, okay, I'll give you um, breakfast and lunch, but you gotta take care of your dinner. So now they are trying to put up and just come up with the dinner. On their next day, you say, like, I'm gonna give you only breakfast, and they're arranging on. So it's you are conditioning, telling the body that I'm going to support you, but I'm going to start taking that off every single day. You got to come up with what do you need after that. So the first day you give them the most support, you give them 6, right? Next day you reduce 1 and the body has to come up with their own. Next day you reduce another, body has to increase that. So eventually the body has what they need. But if you gave them breakfast, lunch, dinner, tomorrow you didn't show up, the person is in shock, like, what, where did they go, right? So similarly, if you give it like 6 and the next day you don't show up, the body's like, what, I'm not ready to make my own. So you are telling the body to start making their own. That's the reason you taper, okay? And this is the reason. That's the condition. If you abruptly stop them, what can happen? Come on, come on, come on, come on, come on, guys. Come on. Let's try to answer quick. Okay, so now we're talking about steroids, right? So corticosteroids. The correct answer is B, adrenal insufficiency. Insufficiency means not having enough. Okay, and who produces them? Adrenal gland. So adrenal insufficiency. Adrenal gland not making enough. They will go in shock. It's suppressed. They're not ready. Okay, that's serious thing. Now, adverse effects associated with your long-term use of steroids. What should you know as a nurse? What you should educate your patient? What to watch or monitor? That is important with steroids. Excuse me. Okay, let's talk about it. Number one, increased risk of infection. Do you think that is right, and why?
It suppress the immune system.
Yeah, it suppresses the immune system. When immune system is weak, high risk of infection, right? So you tell your patient, hey, stay away from 2 sick people. Why? Because your immune system is weak. You're gonna get sick, right? Number two, hypoglycemia.
It actually called hyperglycemia.
Yeah, excellent. Hyperglycemia. Anytime your patient is taking steroids, their blood glucose gonna go up. What kind of patients you should monitor closely then?
Patient who taking
Hyperdiabetic.
Diabetic patients, because diabetic patients has high blood glucose, right? And then if they take this drug, what's going to happen? Their blood glucose is going to go high. If they're in hospital, you're giving them insulin and you're giving them steroids, you may need to increase the dose of insulin during that period. And then you drop it down afterwards once you stop it. Okay, so with your diabetic patient, you tell them to monitor or check their blood glucose more frequently. Okay. Now, osteoporosis. What is osteoporosis?
Weakening of bones.
Weaker bones, right? High risk of fractures. Now that is correct. Long-term use of steroids make the bones weaker. It decreases the bone density, makes them weaker, especially if older patients, their bones are already weaker, right? And if they're taking longer, become more weaker, fall, fractures. Okay, weight loss. Is that right?
It's actually
Wrong.
weight gain.
They
Weight
gain weight. Yeah, so that is not right. How about cataracts or glaucoma?
Yes.
Yes, like your glaucoma, cataracts, that is increased intraocular pressure. And when they're taking steroids, increased risk. Okay, so cataracts, glaucoma, yes. How about suppression of adrenal gland?
Yes. For long term.
Yes, long term, correct.
So it could be A, C, E, F, right?
So A, C, E, and F.
Teacher, I have a question. So if they taking a long time for prednisone, right? And we know that patient have Cushing syndrome, should we stop the medication? I mean, we notify the doctor. Should we tell them to stop the medication right away, or just wait for the doctor?
So if the patient has Cushing syndrome,
Yeah.
the patient, I would say, in general, if you're generalizing it, then they should not be taking it. But now, what if the patient is at a much higher risk of with the condition they're experiencing and they need it? Okay, then, well, yes, first you confirm with the doctor, like, hey, is that meant to be that way? That's a risk, and you want that, right? And you confirm, then you monitor the patient more closely if they needed their conditions, when even though patient is at a slight risk of something, but if they don't take that medication, they are at even much higher risk, then those medications can be administered. Okay.
Thank you.
It's about, you know, you're giving an option. Hey, you want to cut a thumb or you want to cut your throat? So like, okay, here you go, right? So you're gonna see the benefit versus risk ratio. Okay. Okay. Okay, yes, you're absolutely right. B is the correct one here. So when should they take it and why?
In the morning, since it's for inflammations to prevent the pain they having, maybe.
You're right, to some extent, in the morning, but why?
It's to match the, I can't know how, I don't know how to pronounce it, but it's the cycle that starts with the diurnal cycle.
Right. Good job. Yes. So that's what you're trying to match, as you said, what the normal, the natural way when the body produces. Okay. So you wanted to mimic that. Another thing is, there's another angle. If given later during the day, you can make your patient more active. Okay. They won't be able to sleep. That is another thing. Okay. Any questions so far, guys, about anything? Everybody's okay? Doing all right? Okay. Easy peasy. Let's answer quickly, guys. This is what we talked about it. Okay, good job. Yes. C is the correct choice. Hyperglycemia. Blood glucose goes high. Blood glucose goes high. Okay. Here's another one. Patient has CKD, chronic kidney disease. Given epitine alpha. What should you report? Do you know what this drug is? Anybody know what it is?
Iron.
To increase the blood, increase the iron level in the body or blood.
Increase the hemoglobin.
Yeah. You stimulate the process called erythropoiesis, which means the production of RBCs, red blood cells. And in which patient? Who has anemia, right? Or patients has CKD, chronic kidney disease, or they're on chemo. Okay. And it can do the risk is here. B. Blood pressure high. Look at the blood pressure, 160, 90. Patient has CKD. High risk, high risk, high risk. Hemoglobin level of 12. That's not something to report, right? You need to still monitor the patient has that condition, but it's not something that wants some sort of kind of reporting. That's fine. Okay. All right. Easy and breezy. Let's answer this quickly. We still have like 20 slides to go, guys. Let's rock and roll. Quick. Yes. Good job, proud of you guys. Yes. That means you guys were listening. Hemoglobin level, hemoglobin. Yes. Okay. Now, somebody diagnosed with iron deficiency anemia, like anemia different types, right? You guys have heard about that, right? They may have iron deficiency, they might be deficient in vitamin B12, like folic acid. So with iron deficiency, what's the most commonly drug given? Good job. Nice. On everybody, answer. I know sometime you may think, oh, I know it. Let's just keep it to my mind. Please type it. Okay, it's A, guys, A. Ferrous sulfate, FeSO4. Ferrous sulfate is the most common and also the most cheapest. Okay, and these insurance stick with the most cheapest one. Ferrous sulfate tablets, usually 325 milligram QAM in the morning, because that's one best absorption. Okay, empty stomach. And you can also tell them, if they increase or takes vitamin C or anything with vitamin C, that can increase the absorption of iron as well. Okay. Okay. Now here is another formulation. Okay, these are not tablets. So what if liquid form? Maybe it's a kid, or somebody cannot swallow a tablet. Then you're giving them liquid for iron deficiency anemia. It's the same drug, different formulation. What is important about it? Okay. Yeah, excellent. Good job, everyone. Yes, Brenda, you're right. Orange juice has vitamin C, so you wanted to increase the absorption, right? That's why orange juice is there. Why we're using a straw? Because they can stain the teeth, right? Good job. Yes. Okay. Now this can apply on anything, okay? Anything that if you give something incorrectly in a drug, like what should you do? Like they may say like what to do first, or if they give you a scenario about a particular disease or it's about any specific drug, then you probably have to think about, okay, what's important for this condition or with this drug to monitor what to do. But in general, always remember ADPI. You guys know ADPI, right? Assessment, diagnosis, that, right? So always assess your patient first. Okay, so B is the correct answer here. Now here, because it was insulin, they may just throw some other drug or other condition or something, but always remember, assess the patient first, because what you're going to do after that, you're going to call the doctor, right? You're going to call the doctor, but if you haven't assessed, what you're going to tell the doctor? So collect the information, the data, by assessing the patient first. Right? Agreed?
Yes.
All right. Thank you for your being so kind, okay? Agreeing with me. All right, guys, next one. So 52-year-old patient newly diagnosed with type 2 diabetes mellitus. Pharmacological therapy means the medication, right? So what's the first line? Okay, good job. Come on, everyone. Please put your answer in there in the chat. A, and A, metformin. Okay, it comes in class called bigonide. That's the only one in that class, metformin, and that is the first line therapy. Okay, it's safe, it's cheap. That's what they start on. But I see the efficacy going down, down day by day. Okay, so tell your patient to change lifestyle, what they eat, what they do. That'll make the biggest difference. And there are some drugs in diabetic patients where you have to worry about risk of hypoglycemia, blood glucose going down, and that's very risky. That's much high risk as compared to hyperglycemia, right? If it drops dramatically, patient can go into coma. So you have to be careful because some drugs are not going to put your patient at risk. Some drugs, well, for example, metformin, no, it's not going to do that. Unless patient is like not eating for 5 days. Well, that does. But if your patient is taking, go ahead. All right. So if your patient is going to take like glyburide, glimepiride, glipizide, well, they will be at high risk of hypoglycemia. The reason metformin does not increase insulin level, and that's what brings the blood glucose down. So that's why there's no risk. But glyburide, glimepiride, glipizide, they poke pancreas to release more insulin. When there's more insulin, blood glucose goes down, and that's why the risk is high. Same when you give them insulin. Insulin brings blood glucose down. That's why we need to monitor those patients for hypoglycemia. Does that make sense? So you need to know, like, it's not that all diabetic medication are going to put them at risk of hypoglycemia. No, but we need to know which ones. And how we'll know that? How does it work? What are they doing to fix the problem? Blood glucose is high. That's the problem. How they are bringing it down, that's what makes the difference of what we need to know about this. Okay? Okay, now, the patient taking metformin, they're going for a CT scan. And it's with contrast. What is important here? This is a very high risk, okay? Okay, so majority answer correct. There are some incorrect answers, but let's talk about it, okay? Excuse me. The correct choice here is C, okay? Now, let's open it up and talk about it. Why and why? Patient is diabetic, taking metformin to control the blood glucose. But now you're sending them for a CT scan. Now there are two types of, there's without contrast and with contrast. If they're going without contrast, you don't have to worry about it, okay? With contrast, that's what you have to worry about it. I mean, these days, majority of these diagnostic centers have changed their dyes, which usually does not interact, but for NCLEX, because you don't know where your patient is going, what they use. So for you, clear, if you're taking metformin, you're going for a contrast CT, stop metformin. When? 1 day before, okay? And until 2 days after they come back. Okay? Total 3 days, 72 hours. 1 day before, 2 days after, they should not take that. Reason why? It can cause lactic acidosis, buildup of too much lactic acid. Okay, it's a serious condition. A patient may end up damaging kidneys. So that is the reason we educate them about it. Is everybody clear? Any question? Anything which is not clear? Everybody's all right? Yes, good. Okay. Now, next one. Patient diagnosed with diabetes. Okay. Now, they're asking about insulins here. Remember the rapid acting, regular, intermediate, long acting, ultra long acting. We need to know which one are rapid acting. And I'm sorry, this is actually, I put it wrong. It should be select all that apply. Right? The logs are rapid acting, like Humalog, Novolog, right? BND. BND. A is not, I'm sorry, A is not. BND, insulin aspart and insulin lispro. So please know both things, okay? Insulin aspart is Novolog, or Novolog is an insulin aspart. Know that. Same, Humalog is an insulin lispro. And don't just remember like Novolog and Humalog. No insulin aspart and insulin lispro as well. And similarly, don't just know insulin aspart, insulin lispro. No Novolog and Humalog as well. Like which one is what? Okay. They are designed to mimic the body's natural insulin response when somebody eat. That's why they're given with food, right? Within 15 minutes or so, 10, 15 minutes. Okay. All right. Now, which one are short acting? What's the other name of short acting? Okay, come on, guys. Quick. Yes, good job. They're also called regular insulin, okay? So you will see R at the end of their name, okay? Humulin R, Novolin R. That means Humulin regular, Novolin regular. They're short acting. Okay. How about intermediate acting now? There's so many people disappeared. Where's so many cameras off, guys? Where are you? Come on. Few more minutes. Keep your camera on. Okay. Yeah, C is the correct answer, guys. Intermediate, they're your NPH insulin. They will have N at the end. N at the end. How do you identify them? Well, how they're different than others? What's the difference between other and these NPH insulin? Good job, Katrina. Yes, they're cloudy always. Okay, they're cloudy. If they're clear, they're bad. And if all others, if they're not clear, they're bad. Only cloudy one is NPH. Okay. And we're going to talk about when you're mixing insulin as well. Okay. Next year. Long acting. Good job. I'm proud of you. Good job. Yes. Glargine or Lentis, they are long acting. That's why they're called basal insulins as well. The reason, they're given once a day. They're good for like 24 hours. And there's almost negligible risk of causing hypoglycemia because they don't cause peaks. Okay. Okay. Now here, you're mixing up insulin. One is regular, other is NPH. So one is clear, one is cloudy. Okay. Majority of you did answer correctly. Good job. B, remember, clear before cloudy. Regular is clear, NPH is cloudy. So cloudy always goes second. So you never draw that first. Always clear, which is regular first and NPH after. Okay. Understood? Any question? Okay. Next. Patient has diabetes, right? And patient is shaky, lightheaded, sweaty, all that. And when you check the blood glucose, it's 55. So patient is conscious, but blood glucose is low. What to do? And the patient's condition changes your course of action and what you should be doing. So B is the correct choice here. Give the patient simple sugars, right? Which they don't have to break it down. So something orange juice or milk or soda or a tablespoon of sugar, honey, or very commonly like glucose tablets, right? If they're conscious, they may have with them, or you have to give them glucose tablets or give them orange juice or something or soda. Right now, another scenario. This patient is found unconscious. So you checked it, it's 40. Now what to do? Now, if it's unconscious, you can't give them anything to eat or drink. Okay, everyone. Good job. Yes, is the correct choice. Glucagon. Okay, glucagon. And before you administer glucagon, make sure you turn the patient sideways. Do you know why?
For aspiration risk.
The patient, that drug can cause vomiting. Okay, and can choke.
Mm-hmm.
Good job. Okay. Do you guys know what this drug is and why it's used? So desmopressin is an antidiuretic hormone. Okay. Now, what does the diuretic hormone does? Diuretic hormones increase the output, right? Antidiuretic will decrease, means they're gonna hold more, right? So if they are now holding more fluid, then what's relevant here? And we're looking for the incorrect here one, right? The need for further teaching. I should monitor my urine output, notify provider if it decreases too much. Well, that's correct, right? They should. I should avoid drinking too much water to prevent fluid overload. I can expect to feel very thirsty even after taking this medication. Now, what does this drug do? Hold water or excrete water?
Hold water.
Hold water. When you have more water, are you going to feel thirsty or not? No, right? When they were losing, that's when they feel. So they should not. That is what needs further teaching. Right? Everybody clear? Why that's right one? Yes? So you need to know what the drug is. How does it work? What does it do? The antidiuretic hormone. Okay. Same drug. Now this drug, given for that condition, diabetes insipidus. Now this is not diabetes mellitus. It's not high blood glucose. It's a hormonal condition, right? Diabetes insipidus. Remember we're talking about antidiuretic hormone. So patient, when they are deficient in that, that's when the condition is. Okay, so the correct choice here, guys, is C. Priority is about blood pressure, heart rate, and also your pulse. That's what you need to do here because it's an antidiuretic hormone. It can cause fluid retention. Remember, it's going to hold the fluid, more volume. Now, more volume. Who pumps the volume? Who handles the volume in the body? Heart, right? Now be impacted. When it's too much volume, your heart is going to stress out. We need to monitor that. Does it make sense? Now, other things might be important as well, but that's what the priority is. Okay? Okay. The patient has hypothyroidism. Which lab monitor? Yes. Great job. Absolutely correct. Yes. A. TSH is what they ask you. Another thing, some guidelines you may see, they're telling you they present the question worded differently. Sometimes they say before starting, some they say like while the patient is on it, what to monitor, that kind of words they can throw on. The primary test, which is more reliable, that is your TSH. Okay. But in some places, some guidelines, you may see another thing which you should be monitoring along with TSH is free T4. Free T4. Okay, so you may see TSH some places you may see TSH and free T4, but make sure it's free T4. Okay. Next, patient's hypothyroidism, like without the labs, how do you know? Like, what are the signs and symptoms your patient with hypothyroidism can experience? For this, you need to know, like, okay, hypothyroidism, what it is. It's an metabolic disorder, right? So It affects metabolism. Like, what are the things associated with that? So I'll tell you how to remember it. Okay, just a little tip. Okay, hypothyroidism means the thyroid is what? Hypo. Hypo means low, right? And I'm telling you the disorder, this is a metabolic disorder, right? So hypo means the metabolism is low. Now metabolism is low. How are you gonna feel? Are you gonna feel low or are you gonna feel active?
Everything's low.
Low, right? Now, when you are low, your metabolism low, you're feeling low. When you're feeling low, are you excited about things or you can feel more like a depressive kind of thing?
Depressive.
Depressive, right? Now, you're low, okay? Then are you gonna be more energetic or are you gonna be more tired?
Tired.
Tired. So you see that fatigue, right?
Mm-hmm.
Right there. Now, you are low and slow, correct?
Mm-hmm.
Low and slow. When you, the days when you're low and slow, do you feel cold or you feel hot?
Cold.
Cold, right? You're like, okay, give me some blanket, right? Cold intolerance, right? Now, when you're low and slow, you're sad, you're not moving well, you're not having any activities, okay? You're not eating well, you're not drinking well. Is your skin gonna be dry or normal?
Dry.
Dry. There you go. Now, you are low and slow, sad, sitting, blanket on. Is your heart rate can go down or up?
Down.
Down, bradycardia, that's what it is, right? You are low and slow, feeling sad. You're not having much activity. Are you at risk of gaining weight or losing weight?
Gaining weight.
Gaining weight, right? And they're saying here weight loss. No. So now you know which one is right, which is wrong.
Mm-hmm.
Everybody have clarity?
C, E,
A, C, D, no, not D, sorry, A, C, E, and F, right?
Yes.
Yes, everybody agrees? Now, think opposite. What if your patient has hyperthyroidism? What do you think they're going to experience? Instead of fatigue, what they're going to feel? Anxiety.
Restlessness.
Restlessness, anxiety, right?
Tachycardia.
Weight loss, yes, metabolism is high. Now,
Heat
are they going to be
intolerance.
cold or hot?
Hot.
Hot. So heat intolerance. Now, do they going to have dry skin? No. Are they going to have bradycardia or what?
Tachycardia.
Tachycardia. Now, there was another thing. You know, when hypothyroidism, you're low, slow sitting, they are constipated. And with hyperthyroidism, they may experience diarrhea. Everybody clear about signs and symptoms? Any question?
That was really easy to remember. Thank you so much.
Yeah, no worries. If anybody still did not understand, let me know. Please, don't hesitate. It's okay to ask again. Is everybody good? Comfortable? Yes? All right, so let's move on. Now, we know the problem hypothyroidism, right? We know the problem. Now, do you know that we were talking about, like, you know, TSH, free T4? There are three things you're going to hear about: TSH, T3, and T4. Okay, TSH, T3, T4. Now, I want you to know this, that in hypothyroidism or hypothyroidism, which level is high, which level is low? Okay, let's talk about hypothyroidism. Hypo means low. What is low? The thyroid hormones, right? What are the thyroid hormones? T3, T4. So when patient has hypothyroidism, T3, T4 are gonna be low or high?
Low.
Low. Now always remember, T3 and T4, they go together. So now they go low together. Okay? TSH always goes opposite alone. So if T3, T4 is low, where is TSH going?
High.
High. So in hypothyroidism, thyroid hormones are low. Which one? T3, T4, they go together down, right? TSH alone goes high. Now go to the other side. Hyperthyroidism means, hyper means more thyroid hormones. What are thyroid hormones? T3, T4. So T3, T4 once again going together, where?
High.
High. Which one goes opposite?
TSH go down.
And it goes down. So is everybody clear how you're gonna see the labs? Any question? Any confusion? All clear? These are easy things, but just you need to understand. Don't just try to memorize them. Understand what's going on, right? Now, let's talk about the solution. In hypothyroidism, the patient has low thyroid hormones, T3, T4. Now, how can we fix the problem? Give them what they don't have, right? What they don't have, or what they have less. T3, T4, right? That's what we're going to give them. If you're hungry, what you need? Food, right? So we need to give them something to fulfill what they don't have enough, T3, T4. So here we are. Do we know which drug is the drug of choice?
Levothyroxine.
Yeah, levothyroxine is the drug of choice. Very effective, very cheap. As I always say, the insurance love that cheap product, right? But it's safe as well, and it's proven. They're expensive drugs as well, armorthyroid and all that, but not many insurances pays for it. The data, they say data doesn't suggest much kind of impact of ads more than as compared to levothyroxine. It might be here and there, but well, that's what the data suggests. So levothyroxine. Now levothyroxine, what is that? It fulfills that gap. It's a synthetic form of thyroid hormone T4, thyroxine, right? Which gets converted into the active form T3. Okay, in the body as well, T4 gets converted into T3 normally as well. Okay, so we're giving synthetic T4 gets converted into T3, fulfill that deficiency. Problem solved. Yes. This drug has many. If you look at like how many strength it comes in, you'll be surprised. It's one of those like you don't see. That many strengths, because a slight change in dosage can change the patient's symptom from hypo to hypothyroidism. So they go like, okay, from 12.5 or 25 micro, and it's in microgram always, micrograms, okay? The 37.5, 50, 75, 88, 100, 112, 125, 137, 150, like that. That's micrograms, that's how it goes. Because they need to change the dose little by little. If you change it, kind of have a bigger jump, the patient may experience opposite symptoms, hyperthyroidism, right? You don't want to do that. So it comes in so many different strands with a slight increments, and they come in different colors. They're color coded. Okay, you don't need to memorize that. But in pharmacy school we need to know, like patient brings like a purple color. Oh, which strength is that? Okay, you need to know. So, if you ever, wanted to know, I can share a mnemonic with you guys, and you can even know with the color, like what strength that is. Okay. I have that orangutans will vomit on you before they become large, proud joints, and their first letter defines the color. Okay. And I wrote down the strength starting from minimum to then moving forward. But anyways, this is what it is. Now let's move on to the next one. Now, what if patient has hyperthyroidism? Means too much of T3, T4, right? Now you need to manage that condition. Which drugs are usually given? So this question is a little broader. So let me explain, okay? Excuse me. Now here, they're producing too much, right? Thyroid gland. So you need to give them something which slows down the thyroid gland. Say like, hey, we don't need that many. We have too much, right? So the top two drugs you're going to see are A and B, okay? Methimazole and propylthiouracil. But your potassium iodide and radioactive iodine is also used for that purpose, okay? Is also used, but they're more aggressive for more severe conditions, kind of, you know, but that's correct. In general, if you have to know, then A, B, D, E. Levothyroxine is for hypothyroidism, right? All others can be. Most commonly, they are methimazole and propylthiouracil. Now, I think I have a question actually. Let's wait for that. Or I don't know if I have it or not. Okay, let's talk about it. Suppose you have a patient who's pregnant, first trimester of pregnancy. Out of the top two drugs, propylthiouracil, methimazole, which one can you give?
I think A.
Actually, it B. B.
I believe.
Is that a guess or we know why?
It actually PTU, U for first trimester, and the A is U for the second and the third trimester.
Yeah, good job.
Methimazole.
Always. First trimester, it's PTU. Okay? PTU. And after first trimester, they should be switched to methimazole. Okay? Because one causes a fetal risk, the second can cause organ damage, and based on the trimester, one, it's the fetal risk at that time. The second is then they can damage the organ. That's why you have to switch them. Okay, PTU first, methimazole afterwards. Okay.
Can they stay on their medication until the end?
As I said, first trimester, propylthiouracil. After first trimester, you discontinue propylthiouracil and they can continue methimazole afterwards.
Okay, thank you, Professor.
Okay. Okay. All right. Now this is about growth hormones. Patient is deficient here, so definitely their growth is slow, right? They gave them a drug, somatropin. Correct understanding of this medication. It's a little challenging question, so let me explain. So patient is 10-year-old, right? They're deficient, they don't have enough growth hormone, so they want to give them something so that they can grow as close as they can to normal. So somatropin is used for that, right? It's a synthetic growth hormone for children who has hormone deficiency, right? So this is given like IM or sub-Q injection. And this is continued until the child achieves like an acceptable growth rate or until the epiphyseal, the growth plates close.
I saw this question on ATI.
An ATI? Okay, good. Okay. All right. Next, patient 45-year-old diagnosed with acromegaly. Means they have too much growth hormone. Which medication given to reduce that? Okay. Yes, absolutely right. A, octreotide or sandostatin. Okay, good job. Okay, and if the patient is taking that medication, what should you monitor? What's the patient risk of? Oh, come on, guys. Last question. This is the last question. All right. So looks like everybody answered correctly. A, blood glucose. Okay, this drug can increase the blood glucose if the patient is diabetic or any risk of high blood glucose. It requires close monitoring. Okay. All right. Okay.
Question, if the patient is not diabetic, does it still mess with blood sugars?
It can still increase the blood glucose level. Yes.
Okay.
Yep. The diabetic patient, it just the risk level is much higher as compared to non-diabetics.
Yeah.
Okay. Good. Okay. Any other question, guys? Any question you may have? Any topic you want to discuss or anything else you want to go over? Denise, you have a question?
Yes, I just wanted to make sure for them topics for this quiz is 4 and 5. Yes? Okay, thank you.
Yeah. Anyone else? Any other question, guys? Anything else bothers you? Any topic which is giving you a hard time?
Thank you for your time, Professor, even though you're not feeling good.
No problem. It's all good, guys. As I said, I want you guys to do well. It's anything, guys? No? Okay, well, thank you for your time. Hope,
one question.
Yeah.
You had mentioned there's 1 point being given. Is it for the last exam?
Yeah, previous exam.
Okay. And again, thank you for your time. I know that you're not feeling well. A lot of us are struggling.
I'm glad that, I was able to push. So now I'm going to get up and I think that's, I'm waiting for, I have to get a shot. It's kind of tough, but, I'm
Feel
happy
better
that,
soon.
thank you. Thank you, everyone. Good luck for your exam.
Thanks.
Once again, think, when people say all the time, like, think critically, I would say, just think practically, normally, okay? And usually that will lead you to the right answer. You know the stuff, you read it, but things get mixed up. Develop a method to separate them out so that it's not an unwanted plate of salad which you hate, like, yeah, I don't want, give me something good, right? So it get mixed up, these adverse effect, what to monitor for what. And that is the reason I gave you an example in those the lists I shared with you. Like, that's how you should develop, like drugs affecting kidneys, doing this, or which one works how, what to monitor, which labs to monitor what. that makes your life much easier. I mean, even though doing that, it's still not that easy. It's still tough, but it helps you quite a bit. Okay.
Mhm.
All right, guys.
Sorry. Do you know, would you update this video again to the YouTube link?
Absolutely.
Thank you.
Yeah, I'll try my best to post it, upload it tonight before I go to bed.
Thank you so much.
Thank you.
Okay. And anything else you guys need, let me know. Okay. Just prepare well. And anything doubtful, you feel like it, I'm still not understanding, you know, and then the exam is coming. I need more clarity. I need help. Please send me a message. Okay. I don't want you to struggle. Please don't struggle. You know how you're feeling, and if you're not having some topics, any questions, always please, I'm here for you. Let me know. Okay?
Professor, can you support other professors that are teaching other classes? Because I can say that a lot of us don't feel the support from another class.
I think everybody is, you know, doing their good job, and then you know, they're doing their best. Everybody's different. You know, everybody set up their priorities in different ways. And as I said, like, I'm doing this because I have different reason, I have different vision for you guys. You know, as I said, like everybody loves money. Like, you know, I love extra money as well. Everybody needs it, but hey, that's, I have other resources as well. I like doing this. You know, if I just say like, oh, you know, I'm doing this for free, I don't want money, like, no, that would be a lie. You know, we all need that. But when you enjoy doing something that makes a huge difference, that changes the whole outcome when you love what you do. And I'm doing it from 24 years, pharmacy, nursing students, and I just love it. The reason it is, I see how many of you here. Do you know how I see you there? I don't see just you here. I see your families around you. Okay. I see your kids around you, how it's going to impact them. Okay. A positive and negative impact, a positive and negative outcome on your path is not only going to affect your journey, your life journey, it's going to define theirs as well. Okay. And if I can put up a little extra effort, and that will bring a positive change and make your path a little bit more bright, and you can achieve your goals. That's the best I can achieve in my life. It affects a lot of lives. I multiply it with, you know, every student is a family. Okay, how many family members you have in there, and what you can do for yourself, what you can do for them, makes a huge difference where you're heading to. If you're successful, you can do better for yourself, for everybody around you, your kids and everything. I know it's a sacrifice. It's not easy. It's not easy journey. You know, it's not easy journey to achieve. Remember, if you're not having hard time, okay, if you're not finding yourself challenging situation, if you're not finding yourself where you don't have enough time, you're not probably not moving forward. Okay. And I'm sure you all are feeling that way, that you're always short in time. Is that right? Am I right? You always feels like short of time? Too many things in too little time, right? You guys agree with that?
Yes.
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 I can guarantee you, you are moving in the right direction. Okay, guarantee that. It's not that you're struggling with the course program. No. Everybody goes through this, but you're on the right path. Now, what you should do, never get tired. Okay, never get tired, no matter how difficult the situation is. Keep pushing. Remember this thing, guys. I'm doing this for long enough. Okay, I was in your shoes one day. I was sitting there too. Okay, and I know a lot of drugs, as one of you said that, and I know that all of you feel the same way. A lot of drugs, but trust me, I was in one much worse place. Okay, in pharmacy, they're much more deeper. You have to dig in there, nightmare. And if you think I did not go through this, no, I had a hard time too. But then you ask yourself, and okay, yes, hard time, I got it. But am I the first person going through this? No. Am I the last person going through this? No. Well, then what did they do, or what they're gonna do? Do that. You gotta push hard, and you gotta find the loopholes, plug them. If you are finding yourself short in time, ask yourself, okay, let me write down what are the things I'm gonna do tomorrow. What are the things for these next few weeks or days or hours I can kind of push backwards and steal that time to put up more and add that into my study times. It's not for forever. It's for only a few weeks. Okay, and all subjects courses does not require that much time. You have to make adjustments, prioritize things. In nursing, what you do, you prioritize your patients, right? You got 10 patients, you're not going to go to 10 patients all at once, but you are not going to leave anybody. You're going to see all 10, but you're going to see one first. What is more important? Correct? Same here. You're putting up your time, which you could be spending with your family, your kids, right? I felt that when I was in school, like I'm missing a lot. I couldn't go anywhere. There are marriages, there's good or bad things happening. I'm always out. I felt bad, right? But hey, you gotta prioritize things. That little sacrifice gives you much bigger return in life. Working hard for 2-3 years gonna make your whole life easier. Okay, so whenever you feel tired, or tell yourself like, hey, I've got to achieve these goals. I don't want to struggle all my life. I'm ready to work hard now. I'm going to cut some hours from here and there. If I used to sleep at 8 hours, well, I will sleep 6 hours as long as I don't kind of, come across any big issues. I don't even remember when was the last time I ate 8 hours. I don't know how many years ago. I don't sleep more
I
than
think,
4 to 5 hours. Never.
is it normal to sleep 4 to 5 hours?
Okay, look now. It's about like I like to go eat like at a restaurant, right? But can I every day or should I? No, right? So yes, if we have time to 8 hours, go ahead, do that. But in order to achieve more than others, you have to pay more at this time. The people sleeping more or doing other things, if you're watching a movie, I'm not saying don't watch movie, but you have to cut from somewhere. 24 hours are never going to be 25 or 26. It's always going to be 24. Now, what others are doing in 24 hours, what can you put aside as say that that's clutter? I'm not going to prioritize that. Cut those hours and invest in here in your future, in your studies, and that'll be the best investment. I'm never going to say don't do this, don't do that, do that, but just prioritize things. Okay, because everything has consequence, good and bad, right? Now you put up work hard, that will take you where you want it to. But if we want to go on ease now, well, we'll have more hurdles. Okay? And as I always say, don't expect it to be easy journey. Student life is very challenging, and being an RN, becoming an RN, it's not something little. It's a lot of hard work, dedication. You're putting up your time, and it's not cheap. Okay, money, everything. Think about it. Can we even afford to lose this? Can we afford to put that on risk? No. When and we cannot risk it, when that's what we do, fight the hardest, right? Fight for it like a life and death situation. Become fierce. Okay. If you don't know anything, the only way to overcome is to know it. That thing will never bother you. Okay. But if you keep skipping that, it's going to keep coming in one way or another. You will see questions which you skipped. Right. So I hope that makes sense. I'm not here to just say like, okay, you know, just this, that you can skip that. No, I'm not going to tell you that. I'm going to give you the right direction. Okay, which may not be easy, but one thing I can guarantee you, if you follow what I tell you, you're gonna achieve your goal. And that's why I'm sitting here with you. Yes, my head is hurting, but it's not gonna kill me. It's just gonna give me a hard time. But the smiles I'm gonna see on your face the day you pass your course, that's much more valuable. I can tolerate when I want to see smiles on your faces. But as I said earlier, I need your help. I need your help, your sincere dedication. Right? I always say, students are monks. You have to stay focused. In life, especially these days, there's so many distractions, so easy. Like you kind of move your face away from one, there's another one waiting for you. You know, you don't want to watch TV, your phone is there. There's somebody else is there, something else is there, here, there, everywhere. Okay. But you got to say, like, okay, do I need it? That's not required to survive right now, right? So what you need here is your focus on your studies. And always, guys, always, as I say, first ask yourself what I need to know. Do not waste your resources, which is time, meaningless without focusing like what to focus on. I hope that makes some sense. Don't try to know everything because that never happens. Okay? It never happens. In 29 years in this field, even I don't know everything. There's something comes up every single day. Sometime in the morning I open up like there's update. What is that? I never heard of it. So that's gonna happen. NCLEX don't want you to know everything, but I want to make sure that you know what you should know as an RN. Okay? Focus on the right thing.
Yeah, thank you so much, Professor. I just want to say thank you because I study at night. I have 4 kids. And when we started pharmacology, I was scared because it was my weakest subject, but I'm doing really well just because of you. So thank you so much. And the
It's
other
your
subject,
hard work.
like health assessment, I was like piece of cake for me, but I'm struggling in that subject because the teacher is not helping at all.
Hey kiddos, how are you?
Yeah, thank you so much for
Yeah,
everything you do.
you're very welcome. And I can tell you one thing, guys. Put up a little extra effort. Okay, little extra effort here for how many weeks we have now?
2 more weeks, maybe 3.
So you're almost there, right? So now don't relax. Be more aggressive. Okay, be more aggressive. Fight more hard. Okay, put up everything you have now because nobody want to read it again, right? So we want to work hard now, whatever we have left, less, so that you can maximize. And one thing, I'll tell you this thing. You may feel that, yeah, we passed the course after that, we're gonna forget it. Okay. They may get a little faded, but the things I've been telling you, they're gonna keep sounding here in your mind. Whenever you're gonna see these drugs, majority of the time you're gonna know what is important about that drug when you land on the moon. La la land, right? On the floor. And that is gonna make you a super nurse. Remember I told you guys, I don't want you to be a nurse, super nurse, who knows what they are doing. I don't want my students to be scared when they see the drugs, like, I don't know what's going on. What is that? This and that. I want you to know. And all these things we've been talking, exactly that's what you're going to see there. And that's what is important for you to know to keep your patients safe. Remember this thing. You are going to be great nurses, okay? If you're learning this, you will remember this. And people will respect you for that. Mark my word. Okay, so keep working hard. Even you're tired, just take a quick nap, wake up, drink some coffee. Hey, right? Jared is like, I want to go to sleep. What are you talking about? Right? I know. Everybody has so much on their plate, but just a little tiny push. Okay, so keep pushing. And at any point, as I said, for anything small or big, you need my help. If there is anything I can do to make this journey easy, just let me know. Okay, take care of yourself, people around you, and as I always say, please apologize to them on my behalf for stealing time from them, but just say that please for a couple more weeks and then you'll pay back, right?
Thank you, Professor.
All right, take it, everyone. Okay, bye-bye.
Thank you, Professor. Good night.
Good night.
Bye. Take care. Bye. Hey, buddy. How are you? What's your name?
What's your name? What's your name? My name's Eric.
Come on.
Eric.
Eric?
Eric.
Oh, you're so cute, Eric. I hope I didn't bother you. Like I was talking a lot, right?
Thank you.
Thank you. Thank you. Thank you for allowing me to steal some of your valuable time. Right? Your mom, she was able to listen to me because you allowed, right? You're the boss.
Yeah.
Right? Yeah. So boss gave us the permission, right? So thank you for doing that.
Boss. Yeah. That's what
You
I
are
said.
the boss. Yeah. You didn't know that?
You didn't know you were the boss? Are
You
the
are
boss?
the big boss.
Yeah. Yeah.
Yeah, you are. All right. Take care, okay? Good night. Bye-bye.
Say good night. Good night.
Good
Bye,
night. Take
Professor.
care.
Thank you for everything. Good night.
Bye-bye. You're welcome.
Bye.
Bye-bye.